session. Could we please start with the roll call?
Yes, Mayor Coombs?
Here.
Council members Bagley?
Here.
Christensen? Finley? Here. Moore?
Here.
Peck? Here. Santos?
Here.
Mayor Coombs, we have a quorum.
Okay, let's stand for our Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Anyone wishing to speak at first call, public invited to be heard, will need to add his or her name to the list outside the council's chambers. Only those on the list will be invited to speak at first call, public invited to be heard. Speakers who do not place their name on the list will have an opportunity to speak at final call, public invited to be heard, or on any of the public hearing items during the meeting. Now we have the November 20th. Yeah, the last minutes, November 29th, 2016 minutes to approve. Anybody want to move that? Councilmember Bagley?
I move the approval of the November 29th regular session minutes.
Okay. It's been moved and seconded. Let's vote.
You can say that you didn't vote because of whatever.
I read them.
Okay, well, if you read them, you can vote. Okay, that passes 6-0 with Councilmember Christensen absent. Okay, next we have the December 5th special session minutes to approve. Councilmember Finley.
Thank you, Mayor Coombs. I move of the minutes of December 5th.
All right, it's been moved and seconded. Let's vote. Okay, that passes 6-0 with Councilmember Christensen absent. Valerie, are there any agenda revisions?
Yes, Mayor Coombs, item 9A is being pulled from the agenda. This is the ordinance 84, which is about the master tax exempt lease purchase agreement. The item was not properly published after first reading, so we have had to call a special meeting to have second reading and public hearing. That'll be tomorrow at 4 p.m.
Okay. Is there a report from the city manager?
Mayor, Council, one of the items that we have to do at this time is I need direction from Council to move the Council Contingency Fund, so put it in our rollover process. So if I can get that direction from Council.
Exactly. So moved, Mayor.
All right, it's been moved and seconded. Let's vote on Bonnie. Brian moved it and Bonnie's.
Approximately 89,000.
Yeah. Okay, so let's vote on that. That passes 6-0 with, yeah, that passes 6-0 with Councilmember Christensen absent. Okay, now we have special reports, and I think Mike Butler, the Chief of Public Safety, will provide some information on this issue.
Okay, good evening, Mayor, members of Council. I'm Mike Butler. I'm the Public Safety Chief. The Council's asked us to give you all and the public a kind of a status report of what's going on in our community regarding opioids, prescription opioids, and the heroin. And everybody's heard of what's going on around the country in terms of opioids and heroin having great impact in many communities in terms of overdose deaths. We're also aware that folks who struggle with this addiction tend to be involved in crime, and typically a lot of property crime. And so it's an issue that you're going to find out tonight. We're going to give you a status report. It's not just going to be from the police department, but it's going to be from several service providers and people from the community who regularly deal in this arena. And so I'm going to introduce them one at a time. They're going to come up and talk for maybe 3 or 4 minutes. And if you have questions of them, welcome to ask questions at that point. So it's not just from the police perspective, it's hopefully from a community-wide perspective. I also want to say that, you know, opioids and heroin, there's certainly, we're starting to see more, and you're going to hear from a few people kind of the evolution of what's happened in our community over the last few years. But there's other narcotics and drugs that people are addicted to that we're not going to be talking about tonight, that in our minds are still much more serious in terms of frequency and amount and general impact it has on the community. Methamphetamine is one, and the other big drug that, other chemical substance that no one can hold none of these other can hold a candle to, is alcohol. So there's a lot of folks who are addicted to alcohol, addicted to methamphetamine, certainly addicted to opioids and heroin. One of the key features around heroin and opioids, though, is that it can be deadly. And we're not seeing a lot of overdose deaths in our community. I think we've had 6 over the last 5 years. Compared to Boulder, they've had close to 30 in the last 5 years. But it can be deadly. And the other thing that we're also starting to see a little bit more of is that synthetic opioid, fentanyl, for example, which is incredibly powerful and can be very lethal if it's ingested in some form. So you're going to hear a lot more about this, and so enough of me. I'm just going to start having people come on up. You're welcome to ask questions. And you know, and for us, I just want to say that this is not necessarily the beginning, but this is a continuation of what we want to see as a community conversation, a community a community response to this. This is not something that we just want to see service providers or police or fire involved in. We want to see our entire community. That's how we're addressing this. And just so you know, there was a meeting convened last week involving a number of service providers, people from the criminal justice system, looking at this from a regional perspective, not just from Longmont, but from the entire region. And so we're going to be looking at prevention, we're going to be looking at education, we're going to be looking at how we can engage and get our community more involved, and we're going to be looking at what police and public safety can do in terms of adjusting responses to what we've been doing in the past versus what we could be doing more in the future. So with that, I'm going to invite our first speaker up here is Ann Noonan, and she is from the Mental Health Partners. And so, Ann.
Thanks very much, Mike. And you kind of stole my thunder, because one of the things I always start a conversation like this with is to ask the number one drug of abuse in any community at this point is always alcohol. So while we're seeing a crisis with methamphetamine and more recently with opiates, certainly alcohol is the biggest driver. And the combination of alcohol with heroin has even more deadly effects, so that's a challenge as well. So I'm formerly with the Addiction Recovery Centers of Boulder County Public Health. We merged with Mental Health Partners 2 years ago, and so the Boulder County Detox is under Mental Health Partners now. And I just want to tell you briefly that in the last 6 months, I've brought some figures for you. We've admitted 1,300 people into the detox over this last 6 months. About 16% of those were from Longmont. So we're underrepresented from Longmont in terms of population, but we don't have CU here in Longmont, so that's a factor there. Of those 1,300 people, 8.5% were being detoxed from opiates. Now that is probably at least a triple in the last 3 to 4 years of who we were seeing for detox. And then when we move to our outpatient services here in Longmont, our substance abuse services, we've had 700 admissions into general outpatient here in Longmont at Mental Health Partners. Of those, about 40% are being treated for substance use disorders, but only about 2% are being treated for opioid addiction. And part of the challenge is that traditional outpatient treatment is not very effective. And we have other folks talking about medication-assisted therapies that, in conjunction with outpatient therapies, increase the likelihood of recovery quite a bit. Nationally, we have not seen the end of the escalation yet. We're still on an upward trajectory. I just came back from a national conference in Phoenix where we were looking at opioid prescribing practices, where the pain physicians are starting to get the message, and they're starting to ratchet down on the amount of opiates they're prescribing, and hopefully adding other alternative treatments which are not covered usually by insurance. So you have this problem there. They're reducing their prescribing, but we're seeing heroin still going up. And as people are cut off from their opioids, their pain medications, without an adequate treatment plan and detox plan, a lot of those folks are turning to heroin. So if you've been on prescription opioids, you have a 40 times higher percentage chance of becoming addicted to heroin. So that's the transition we're seeing. 40 times, yes.
40 times, yeah.
40. Yeah. So there are three main areas that we need to work on in the heroin and opiate epidemic. The first is prevention. And the biggest prevention efforts that we're making right now are education around prescription drugs, because we really feel like we'd be reducing greatly the progression into heroin if we could get prescribers to really change their prescribing practices. So that's prevention. There are other prevention activities. We need to reduce the use of heroin, and the main way we can do that is through effective treatments, and primarily medication-assisted therapies in conjunction with regular outpatient. So we have people here from the methadone clinic. There's also a medication called Suboxone that is pretty effective and can be gotten at private medical offices instead of at methadone clinics. And then the final is reversing. So we need to keep people alive while they're having these heroin problems. So the medication naloxone, street name, commonly known as Narcan, is an opioid reversal medication. And your safety officers here have just gotten 150 kits to be able to have carried on the streets. Your EMTs have always had them, fire and EMT, but now the law enforcement folks will have it too. And we have most of law enforcement in the county of Boulder has Narcan. So at the point of an overdose, it's an opportunity for an intervention and hopefully getting someone into treatment. And if nothing else, they stay alive to hopefully enter into treatment at a future time.
You can ask questions now of Ann, or you can wait until the end if you want. Okay. I'm going to introduce Michelle Ryan. Oh, I'm sorry. Go ahead.
Councilmember Pack would like to ask a question.
Mike, turn off your mic. Mike Butler. There you go.
Oh, it's okay. I do have a question for you, yeah, from Ann. Ann, when people are in these treatments and they are given medications, who pays for that? Do they have to be on a medical program? Because sometimes once they start the program and they're released, how do they continue that medication if they don't have any insurance?
So insurance really is a key part to having medication-assisted therapies. Medicaid is covering MATs. We recently had MATs. Now methadone is now covered by Medicaid, which had never happened until recent years. Buprenorphine or Suboxone is covered by most insurances. So it is a gap. We do have some new money coming in from the state to support medication-assisted therapies. That's primarily to stand programs up with the idea that folks, as insurance coverage expands, that more people will have access, and that as parity continues to expand, that people will have full range of access to medications. One of the things that helps is substance abuse services are often not covered well under general insurance, but these medications are often covered under a medical benefit and not under a behavioral health benefit. So sometimes that's a kind of way around some of the limitations.
Okay, thank you.
Thank you, Ann.
Councilmember Finley.
Thank you, Mayor Coombs. My question is, I love that you gave us statistics. I like to see numbers. You said of 1,300, 8.5% were opiates. Can you tell me what that was in the previous years, like in the last 5 years?
Well, I think what I see at 8.5%, I did not pull this number exactly, but I can remember a few years ago that number was more like 2%.
Okay, thank
So
you.
at least to my memory, in the last 3 to 5 years, it's gone up that much.
Okay, thanks.
Councilmember Moore?
Thank you, Mayor Coombs. What does, I didn't even see you walk away.
Sorry, I thought you were talking to Mayor Coombs, and I was ready to go.
What does the age demographic look like for the people you're treating? And the reason I ask is I heard a story today on NPR about the elderly now becoming having more of an issue with this. What are you experiencing?
So mostly what we're seeing is it going younger and younger, from the traditional heroin addicts who were in their 30s, late 20s, 30s, 40s, and we're seeing it plunge down younger. But we're seeing the other end of the spectrum as well. I heard that NPR story as well today. And part of the main risk factor for those folks is prescription drugs. And so they may not even ever get to heroin, but their use of those prescription drugs can be life-threatening. So we are seeing that. Again, as we work with doctors to change prescribing habits, as we get doctors to use the pharmacy, there's a system where they can check what prescriptions people are getting and where they're filling them and so forth. As we're getting people to look into the pharmacy registry, that's helping. But yes, I would say we're seeing bumps in all ages, but primarily in the younger ages.
Okay, thank you. So you said something that was into my next question, but about pharmacy registrations, so you can cross-check. Are there, I don't know, I'm not asking for specific prescriptions, but are there interactions with other prescriptions that would also be caught with that?
There definitely are, and one of the things that we see in opioid overdose deaths is the combination of benzodiazepines like a Valium or Xanax in with heroin, or also alcohol along with heroin. That combination is more likely to cause a fatal overdose. The prescription registry tracks benzodiazepines and pain medications. It's all Schedule I drugs, and Schedule II drugs, I'm sorry. And so as we're training more and more doctors to actually check that, they can see what those drug interactions might be. And especially with the elderly, where they may have 4 or 5 different prescribers for 4 or 5 different conditions, the registry is really critical to make sure that they're not taking drugs that are going to interact dangerously.
So it sounds like that's working.
I think it's working better. We have about 35% of our doctors checking the registry.
Okay.
We'd like to see it at around 90.
Yeah.
But we're doing better than a lot of states that are only at 5 to 15%, and Missouri doesn't even have a registry. And there was a period of time where Wyoming and Utah did not have registries, and we did, and so our folks were going into the other states. So now that 49 states have it, it's making a big difference.
Okay, well, thank you, Ann.
Okay, I don't see any further questions.
Okay, great. I'd like to introduce Michelle Ryan. She's the program coordinator at the Longmont Treatment Center.
Thank you for having me here. I'm excited to talk about treatment for opioid addicts. That's what my business is. I work for Behavioral Health Group, and I'm the program director here in Longmont on 23rd Street. And I can tell you right now our numbers are we have 260 patients that come daily to get their medication for opioid treatment, opioid dependence, and we offer buprenorphine as well as methadone. And my mission as a program director there is to educate the community on what that treatment means to the community. And it's not, methadone and buprenorphine is not one drug replacing another. Because opioid dependence and basically every addiction is a brain disease, what this medication does is it helps stabilize the brain. Once the brain is stabilized, then people get their lives back. They get their jobs back, and they get their families back, and they get back into the community and are able to function normally. And then when they get stable, then we start to wean them off that medication. But the story is that we have 260 patients right now. Out of those 260 patients, I would say about 60% of them are from the ages of 25 to 45 years old. We have probably 10% that are younger than that, from, say, 18 to 25. And we are finding an older population coming in, not using heroin yet, although they have, the story is that if they had to go to heroin, they would go to heroin, just not to get sick. So most of the patients that we see are, they're done using heroin and they're done using opiates, but to get off of them is very painful, very, very painful. So they will do anything to stay out of that withdrawal, which is the pain. And they explain it at like their hair hurts, their fingernails hurt, they're vomiting and they've got diarrhea, and it lasts for days and days and days. It's unbearable. So they're no longer using the drug to get high, they're using the drug to stay well. That's what the story is. So, there is a misnomer out there that there is no treatment, and that's not true. We do treat successfully heroin addicts and opiate addicts. They usually come in and ask for help between 4 and 6 years after use. That's about when they start to get sick and tired of chasing the sickness, really, because they don't get high anymore. The brain can only take so much opiates before it doesn't do any good as far as getting them in that woozy kind of feeling. They just end up not wanting to get sick. And methadone is our main drug that we use in our clinic, although we are now offering Suboxone and buprenorphine, and we do take, Medicaid does pay for buprenorphine, and it does pay for methadone. And BHG is actually right now in talks with other insurance companies, private insurance companies, so that we can bill them as well. That's an ongoing process, and it's nearing completion. But just like anything, it always gets pushed back. But it is being talked about. Our staff is asking for our patients to bring in their personal insurance information so that we can make contact with those agencies. I just lost my thought. I've been up since 5 o'clock this morning. So our treatment center opens at 5 a.m. because we want patients to get there and get their dose and get to work. And we close at 1:30 p.m. And our patients are required to come according to their phase so they can earn takeouts after they've gotten stable to our center. Most come daily. And then they also have to come for counseling. It's a part of their treatment. We are a treatment facility, not a drug dispensing facility. So they are required to come for counseling at least once a month, and our teams consist of clinicians, counselors with counseling certificates and degrees. We also have a full medical staff. We have doctors and nurses at the center at all times to monitor the patients. So the patients get physicals, they get their blood pressure taken, they have urine drug screens, monthly random urine drug screens to help hold them accountable to their sobriety. And I wish I could have had a patient here with me today to be able to tell you the effect that being in treatment has had on their life. It's exciting, it's rewarding, and it's available. I can tell you that people that don't have insurance, it's $82 a week to get treatment. And most people report $500 a week minimum is what they pay for their heroin or their opiates. Yeah, minimum. I've had it up to $5,000 a week. So it depends on where they're at in the spectrum of their addiction. So that is the story I hope to tell, that methadone or medically assisted treatment is not one drug replacing another. It's a way that people can stabilize the brain disease and get their lives back. And with a lot of help. We help them through the process as much as we can, and our staff is full of compassion and empathy for the patients that we treat. And we do treat them as human beings, not as drug addicts or junkies. And we don't use that language in our our facility, and we don't allow other people to use that language in our facility. These are people that have a disease of addiction that are reaching out for help. And it's in your community. It's here. We have it available for you.
Question?
Councilmember Moore?
Thank you. So you mentioned a number of 260 currently coming to your center. Is that number kind of stable, or does that move around a lot? Or?
No, that's a stable number.
So,
yeah.
so it's pretty consistent.
It's pretty
And
consistent.
how long did? I'm sure this answer is going to be it depends, but what does normally a course of treatment take? How long?
It's a minimum of 1 year, and it can take up, I mean, we have patients that have been on it for 30 years that never want to get off of it because they're afraid that they'll go back to heroin. But the average treatment longevity is about 2 years. So they get stable the first year, and then they come down off the methadone the second year, or the buprenorphine the second year.
Okay, well,
That's
thank you.
the average. Welcome.
Councilmember Peck?
Thank you. Councilmember Moore asked one of my questions about the longevity, how long it takes. My other question is, of these 260 patients that you have, how many of them or are any of them homeless?
Yeah, there are. I'd say about 2%. 2%
2%?
are homeless. Mhm.
Okay.
Yeah. And they don't stay homeless if they get sober. And if they,
Exactly.
yeah, we're able to help them because we do case management, so we help them find homes, we help them find jobs, we work with mental health partners if there's a co-occurring disorder.
Mm-hmm.
We rally around them to help them in any way we can.
You also said that some people have been on this recovery program for like 30 years because, are you talking about being on the medication for 30 years or just the medication?
Yeah, the medication. And as a part of being on methadone or any medically assisted treatment, they have to come to counseling as well. So they do both. They come to counseling at minimum of an hour a month, and we also offer groups and all kinds of other processes that they can join in. And they enjoy it. So they come and they're just content with staying on their dose of methadone that's able to help them stay off of illicit opiates.
Okay, thank you.
Councilmember Christensen?
Is this the end of the presentation? Oh, all right, then I'll hold my question or my statement.
Thank you for having me.
All right, thank you.
Thank you, Marianne. I'd like to introduce next now is Carol Helwig. She's from Boulder County Health. I think she has a couple of slides she wants to present.
Just bring the slides. That one, yes. Thank you. Do I just advance it right here? Oh, this is fine. So I'm Carol Helwig with Boulder County Public Health. I've been with the agency for almost 10 years. I oversee the syringe access program, the WORKS program, which is a harm reduction model that serves injection drug users in our community and also offers overdose prevention. I'm starting off with a metaphor for what harm reduction is. If you look at the blue bubbles that say drug dependence, use, misuse, and then recovery and dependence, those are meant to represent the spectrum of substance use disorders or drug addiction. And you'll see that drug dependence or use and misuse is squarely on the bridge, a more precarious position. And recovery or non-dependence is over on solid ground, so more footed, more grounded. And harm reduction is that bridge that offers that safety and protection for folks. And what we're preventing in our the WORKS program is HIV, viral hepatitis, endocarditis, abscesses, which are soft tissue infections at the site of injection, and overdose death. So that's just a quick way to frame what harm reduction is about. We offer our services at 4 different locations in Boulder County. One of them is here in Longmont at the Community Hub. We also have a program in Boulder at the Public Health Agency. We partner with the AIDS Service Organization, Boulder County Public Health, and we also partner with Mental Health Partners, where Ann is working, and that's at the 24/7 Mental Health Partners Detox Facility. I believe that's the only facility, potentially in the United States, definitely in the state of Colorado, that offers 24/7 services for syringe access. This is a very stark chart showing the trends that we've been observing over several years. It goes from 2010 to 2015, and this shows the unique number of individuals who have come in to access syringes at our 4 different locations. And you'll see that back in 2010, we had 149 people, and that number has been gradually increasing and increasing. In 2015, we had over 1,000 individuals come in for syringes. You'll see that from 2014 to 15, that was our sharpest increase, almost a 40%. So it was between 20 and 30% increase each year. And then all of a sudden, we saw a sharp rise. And as of this year, from January through November, we've seen 1,400 individuals, so we've already reached a 40% increase. So that spike is becoming sharper. And as Ann explained earlier, and Michelle also touched on, heroin use can progress to injection. Injection drug use is the cheapest way to maintain a heroin habit because you use the smallest amount of drug and you get the biggest bang for your buck. So a lot of times when folks are reaching kind of the end of all of their resources, they move to injection because that's the only way that they can maintain their habit with the resources that they might have at that time. This is a breakout of what we're seeing in Longmont, and this analysis, I'll have to say, is not an exact science because what we did was we looked at all the folks that we've seen so far this year, and we looked at just the folks who have come to the community hub or the Longmont Community Hub building, so we left out the folks who came to the other 3. But it's possible that Longmont residents are potentially accessing services at one of the 3 other locations, especially the 24/7 location. But so this is just representing 351 individuals who have come into the Longmont syringe access program between January and November of this year. And of those folks, about a third of them completed a survey, and that survey gave us some information that the average age of participants is 28 years old. We see about 68% male, 32% female, which is par for the course with most syringe exchange programs. We do see about 68% of our participants use heroin and 32% meth. This is a little bit different. A lot of syringe access programs see more heroin and not as much meth. And then we did a breakout of housing status. The green chart part is 32% for people who own or rent their home. The lower, larger blue slice is folks who are temporarily housed with friends or family. There's the orange represent the folks who are homeless or who say they live on the street or outdoors, and that's 18%. Then we have smaller pieces of the pie for folks who are living in shelters, transitional housing, or institutional locations. My final slide is about overdose in Boulder County. And these figures represent average rates between 2010 and 2014. If you look at the blue bars, those represent prescription overdose deaths, and the dark purple represent heroin overdose deaths. And going from left to right, we have all of Boulder County, and then we have the city of Boulder, the city of Longmont, and southeast region, which is Superior, Louisville, and Lafayette. And you'll see that in the prescription overdose deaths, Longmont has the highest bar at a 9.4 per 100,000 population. And I did some back-of-the-napkin estimates and figuring in that, is it about 90,000 residents in Longmont? So that would mean that between 8 and 9 people on average over that course of 2010 to 2014 died of a prescription overdose death per year. And with heroin, 1 to 2 people. So we're looking at about 9 to 11 overdose deaths related to opioids and heroin each year in Longmont on average over the course of those years. And in all of Boulder County, we're seeing about 30 overdose deaths per year. So Longmont accounts for about a third of those in our county. And that is all I prepared for you today.
Questions?
Any questions? Don't see any. Thank you.
Thank you.
Thank you, Carol. Next is Marianne Ursich. She's the Executive Director of Community Solutions, a private addiction treatment service provider.
Hello, I apologize in advance. I'm kind of fighting a cold, so if I sneeze, I'll try to step away. My name is Marianne Ursich, and I'm an addiction and family counselor in Longmont, Colorado. I've worked with the addiction and population for over 13 years. Prescription opiate abuse is the fastest growing drug problem in the United States. Colorado is number 2 in the nation for prescription opiate drug misuse. Deaths from drug overdoses in Colorado are reaching a crisis level. Not only does the state's death rate from overdose top the national average, but those numbers have increased across the state. The biggest challenge in Colorado is addressing drug abuse, addressing prescription drug abuse, and ensuring access for those who legitimately need them. Over the course of my 13 years as a professional in the community, I have witnessed an increase in the opiate use disorder. The addiction to disease is non-discriminatory. It can attack any individual at any level in any circumstance. I have worked with people who have put their life at risk to get more opiates. I have worked with people who are willing to rob or steal to get more opiates, and I have worked with people who are willing to risk their lives in order to get more opiates. The opiate addiction disease holds its greatest grasp on those who are the most vulnerable, those in pain. In my career, I have witnessed the trauma of the addiction and strongly support any initiative that can help save the lives of the community members in need. That's all I have.
Questions?
So what's changed and why are so many more people in pain now and need these opioids than what there was a decade ago? I mean, what are people doing to get, are they getting, young people getting injured, or what's causing all this pain to begin with?
The most common thing I hear is I hurt my back at work and I got a prescription. The doctor kept giving me the prescription. My back got better. They no longer gave me the prescription anymore, so now I am seeking more opiates to now overcome the pain of the opiate addiction.
Sorry, let me just jump in for a second. One of the things that we know that tracks almost exactly with the rise of opiate addiction was the establishment of pain as the 5th vital sign a few years ago. And what we saw was that the pharmaceutical companies were very actively marketing their medications as being non-addictive, and that high doses of opiates could be used by folks with chronic pain over long periods of time without negative impacts. And we've seen that that's absolutely not the case. And that what we did, instead of treating pain with lots of different approaches, PT, acupuncture, all those kinds of things, we were only using the opiate medication. And so you can track it exactly, how much money they were spending on marketing, what the prescribing rates were, and now we see this spike in the overdose today. So no, not more pain. 99% of all the opiates, of all the hydrocodone prescribed, is prescribed in the United States, not Western Europe. So we don't see that. It's really the prescribing practices that changed.
Okay, thank you.
Perfect answer.
Any other
Any
questions before we move on?
Yeah, go ahead. Go ahead and move on. Yeah,
Okay,
we're ready.
great. Next up is Sergeant Sean Harper of Longmont Public Safety.
Mayor, council members, I'm here to just give you a little bit of the same of what you've already heard from a local Longmont police perspective. I was assigned as a supervisor of our narcotics unit in 2010. At that time, meth, amphetamine, and cocaine dominated our caseload. Heroin wasn't really on our radar very much. Somewhere 3 to 5 years ago, heroin became much more prevalent, and it is now second only to meth in our caseload. So that's what my detectives are actively working the most: meth and then heroin. And I think from my experience, we can trace the heroin epidemic back directly, like you've already heard, to overprescribing of prescription medication. I think maybe the doctors originally, they didn't necessarily understand how addictive prescription opioids and opiates can be. In some cases, the doctors were making cash profit off of overprescribing as well, and we've run successful cases on some of those doctors. The DEA has cracked down on these doctors, which means they feel pressure to not prescribe as much, and we already have this addiction out in our community, that demand is prevalent. So that's when people go to heroin, or they look for prescription pills on the street. Let's see. The vast majority of our heroin in Longmont comes from Mexico. It typically goes to a major metropolitan area just south of Longmont, and a lot of our addicts, even our dealers, they'll pool together money from all of their friends and people in need, and then one person will make the trip to Denver and then come back and distribute all the heroin or illicit prescription medications. The final thing I want to talk about is addiction as it relates to crime. I don't think that there's any speculation, at least from my experience, that crime is directly related to addiction. Our property crime, anytime we've run a big case, you've seen it in the paper where we do this big sweep. We're arresting multiple people in one day, serving multiple search warrants in one day. It's been my experience that property crime tapers off for a few weeks after that sweep. Again, you heard the statistic about how much these addicts need to feed their addiction. And a lot of times they go through all of their resources and they turn to crime. Some of these people will do anything to continue that addiction, to feed the addiction, to avoid the sickness. I hear that a lot. I did it because I didn't want to get sick. That's a very common thing that I hear. That's it. That's all I have.
Questions?
Councilmember Moore.
Thank you, Mayor Coombs. So, Sean, I know we can't really talk too openly about some of this stuff as far as resources go, but is Longmont spending a huge amount of money, a moderate amount of dollars, resources with this, or if you could kind of give a general category?
That question is relative. We spend all of the resources we are allotted every single year and then some to combat these problems. And again, it's meth and then heroin. Along with heroin, hand in hand, is the prescription opioid abuse. So we have a certain allotment of resources every year, and every year we definitely go over budget, but the problem is there. The demand for the purpose. We have a solid purpose, and I think that we need it. We need those resources.
And I guess just another comment. What I read in the newspaper too is that we do work hand in hand with other agencies in the region in order to make sure we have a more effective program here. So I definitely appreciate that.
No, thank you. Yeah, we partner with Wells County, Boulder County, Larimer County, DEA, FBI, and we do it on a regular basis. Thank you for saying that.
Thank you.
All right, thank you.
Okay, next up is Deputy Chief Jared Van Landingham of Public Safety Fire Services.
Mayor, members of council, thanks for having us tonight. Appreciate it. The chief asked me to speak to you a little bit about what we're seeing through the 911 system, through fire and EMS, and about what we're doing with it. First, I will say that the life-saving drug that you've heard a little bit about already, Narcan, your firefighters have been carrying that drug on our apparatus for as long as we've had paramedics, and it's been approximately 25 years. So we have been using that medication. It's not new. It's been around for quite some time. It's very effective. Currently, we are in the process of training and implementing a rollout for our police officers to carry that drug as well. We did receive 150 sets of that Narcan through the Perry Group, which you may have heard a little bit about, and that's what our police officers will be carrying for them. Now, in terms of numbers, currently Longmont Fire runs about 10,000 calls a year. About 70% of those are medical related in nature. And so we do stay quite busy. In terms of the calls that we've run and utilized Narcan, every year it's average about 60 times a year that we'll use that medication. Now, it's not always effective. A lot of times Narcan is used to rule out other things, and so we used to use it quite a bit just to see what's going on. Maybe check their blood sugar, we'll throw some Narcan at them and see what happens. And but on those cases that we have had success, in 2014 we had 11 specific calls that responded positively to the Narcan administration. In 2015, we had 13 calls. 6 of those were heroin specific. 7 was a mix of opiates. In 2016, so far this year, we're at 13. So not a dramatic number in terms of impact to our workload in fire and EMS, but it is I guess the way to look at this is we look at any time somebody dies that could have been saved through an intervention, we view that as a tragedy. And so one of the things that we've done through police and fire integration is work through our active harmer drills and active shooter drills. And so we've given our police officers and firefighters tourniquets, something simple, but here's a tourniquet and here's how to use it. And if we can stop the bleeding, we can get to that person quickly, and we can stop the bleeding quickly, they may have a chance to survive. And we view these overdose cases the same way. If we can get there quickly and administer Narcan, they will have a chance potentially to carry on their life. So that's why we're rolling it out with our police officers as well. Our call volume is increasing. There's multiple times where we are out of position because we're tied up on other calls, and so that an engine is having to come across the city into another part of the district, and a police officer might get there before us, and we want them to be prepared and able to handle that call.
Thanks, Jared. Questions for Deputy Chief Van Landingham?
What does Narcan cost per dose?
Ann Noonan again. $37.50? Yeah, $37.50.
Pretty cheap.
Yeah, pretty cheap.
Thank you.
Yeah.
Councilmember Peck?
Thank you, Mayor Coombs. Do you have to have EMT training in order to use the Narcan?
No. In the past, yes, but a new Narcan that we're rolling out with our police officers, it can be bought over the counter at your local drugstore for people that have family members that may need it. So we see it as a situation here in Longmont where if we're going to equip our police officers with it, we certainly want to give them the proper training to know what could happen when those patients wake up, and sometimes that is dramatic. So,
okay, thank you.
Thanks, Jared. Our last speaker is Deputy Chief Jeff Satter, Public Safety, Police Services.
Good evening. I'm Jeff Satter, Mayor, Council. I want to talk to you about our Angel Initiative. As you may remember, on August 31st, during the International Overdose Awareness Day, we announced our partnership with the Police Assisted Addiction Recovery Initiative, PERI, and our goal at that point was to partner with this organization, partner with treatment providers, and offer people that have addiction an opportunity to come to the police department, and we'll help get them into treatment. On that day, we asked for volunteers for Angels, and I'll go through this here in a moment, and treatment providers. Again, our goal of this program was to encourage drug users to seek recovery. We wanted to connect Angel participants with treatment programs and facilities. We wanted to connect Angel participants with employment, and we wanted to provide resources to other police departments and communities wanting to do more to help fight this epidemic. We also wanted to help distribute through our Boulder County mental health partners life-saving opioid blocking drugs to prevent treat overdoses, Narcan. So we have 5 different components to our Angel program. We have an Angel Outreach, which is our marketing analyst, Robin Erickson. She coordinates our initiative, our website. She's coordinating all the treatment providers. She's got it on our website so people can search for it. They can look for treatment centers. Anybody can do this, but it's also a resource to our officers. We also have Michelle Webb. She's a volunteer with our Angel project, and she's calling all the treatment providers in Boulder County and Colorado and soliciting their help. We're asking for scholarships. We're asking for all the basics information that you need to get into their program, admittance, insurance, just everything. Our website's pretty comprehensive. And we've had great success with these 2 parts of the program so far. On the day of Drug Awareness Overdose Day, we asked for Angel volunteers. Since that time, we have 15 volunteers that have come to the police department and asked to help. Our Angel volunteers are coordinated by our outreach manager, Kay Armstrong. They're on call, and they can respond to the Safety Justice Center within about 20 minutes. But they're community members who have an understanding, compassion, commitment to help others. And so we call on them. They stay with the Angel participants, and they just, give them someone to talk to. They can write letters for them. They can assist with transportation, tie up loose ends, etc. One of our volunteers here is here tonight, Tom Smith. He's in the back row. You want to give a big wave? He's been to all our meetings so far, but he's one of our Angel volunteers. And their job, again, is kind of just pair up with the people seeking recovery while officers get them into treatment. Our Angel treatment providers, they're treatment providers who have expressed an interest in participating or partnering with us to offer, when necessary, scholarship and treatment, such as detox, inpatient, outpatient treatment, medicinal aftercare, sober living, counseling, AA. We have a variety of organizations. At this point, we have 65 organizations that have committed to help us, that are willing to work with us, and we're negotiating with all of them on how many scholarships we can get. I would like to point out that Marianne, Michelle, and Mental Health and ARC were the first organizations to step up and say, we want to do more in our community. And they jumped in on the first day and were involved in this program. Next part of our program are Angel Liaisons. They're public safety personnel who are our first points of contact with Angel participants. They help facilitate a smooth transition into recovery. Their liaisons include our communications specialists, records personnel, firefighters, administrative personnel, and police officers. We have 20 Angel personnel within the police department, but we also have a policy, and we're going to train all our staff on how they can help get somebody into treatment if nobody's available. Everybody's going to be trained. Everybody's going to know how to use the system. So if somebody comes to the police department, we're going to do our best to get them into treatment. And then last, this is a new part of our initiative, our Angel employers. They're committed to offering a hand up to Angel participants who are in recovery. So after they've been in recovery for a month, in outpatient treatment for a month, we're asking employers to step up and give these people part-time jobs. We're asking for 30 hours a week and up to 2 months of employment. And our goal with this is, again, to give them a hand up, give them some stability, give them some work, give them some relationships, give them an opportunity to interact with others, develop skills. We kind of thought of this one last Friday and started calling people. And today we have 3 employers that have already committed, and they have 6 different locations that are ready to accept people that they want to help in this program. They were all very excited, and one of them wanted to give up to a year employment. So we have some great community businesses that are ready to step up and help. So tonight, we want to announce that we put a lot of work into this since August. At this point, we've equipped, we're starting to train all our police officers with Narcan, which is a life-saving tool. Hopefully, we will never use it, but if we need it, our officers and our firefighters will have it and be able to use it and hopefully intervene and save that person's life. But most importantly, we're ready to kick off our initiative. We're going to start asking Angel participants to come by the police department January 1st, 2017, and we're going to help them get into treatment. We think we have everything lined up. We've got our Angel volunteers, we got our liaisons, we got our employers, we got our, most importantly, our treatment providers. So with this, we hope we're going to save lives, we're going to save futures, we're going to save families. We're going to have an impact. Oh, sorry. Sorry about that. Sean and I, we get to thinking about these things, and I don't want to throw Sean in on this, but when you go on an overdose, and you see how it affects the family, it's very difficult for the family. So anything we can do to help is going to be great for our city. Anyway, so I'll try to get through this, but with our Angel initiative, we hope we can reduce the number of people suffering in our community. We want to remove the stigma of addiction and turn the conversation towards disease rather than crime. And we want to help connect participants with our treatment providers and employers. And I want to throw out one other thing. We work very hard to keep drugs out of our community. SEU does a tremendous job partnering with people all over the state. When we have people that work with our police department as CIs, we don't throw them to the curb. We're aware that they're suffering, and we try to get them into treatment also. So, thank you.
Wow. I think Jeff's able to answer questions.
I'd just like to make a comment. I'd like to commend you. I mean, that's hard work that you're doing, and it's going to make a difference. I think the entire council is really proud of our public safety and the things that you're doing. I just can't imagine how tough of a job that is, and I think we all really respect what you're doing. Councilmember Peck.
Thank you, Mayor Coombs. I also just wanted to commend you. An incredible program, and I'm really proud of the police department for taking this on. You guys are in the trenches, and you see it. So thank you. It's really going to make a big difference. Let us know if there's anything we can do to help.
All right, thank you.
Councilmember Finley.
Thank you, Mayor Coombs. I wanted to echo that. This is awesome, just since August, to get all this together. Also wanted to ask you if there's anything you want from council, and on a personal level, would like to work with finding employers. Mm-hmm. So would like to have a phone call about that at some point and meet with you guys on that. But we really do want to know what we can do to give you the tools you need to be successful.
Thank you. We do plan on hitting up our Chamber of Commerce. I think that's our next stop.
Well, Councilmember Moore.
Thank you, Mayor Combs. Well, I'm impressed. Thanks a lot. I agree that this is my position personally, is that we cannot build enough prisons or jails to house everybody. Let's get to the root cause, not treat the symptom. And I see the programs you're talking about treating symptoms rather than, or treating root cause rather than just putting Band-Aids on. And I have to commend all of public safety for their efforts, because it's a tough problem. And we have to admit that we can do something about it, and we're going to. And I really think that I'm actually shocked that we have this program and it's rolling out, and I'd like to be able to support it.
Thank you.
Councilmember Christensen.
Yes, I want to also congratulate you and tell you, all of you, thank you for all of your incredibly hard work. I know it's very difficult to deal with people who are going through so much pain and have such a variety of problems. But Thank you for your compassion and your hard work. And I guess I also wanted to say that I would like, I guess, for people to understand how easy this is. My son broke his ankle a couple of weeks ago, and this is what the doctor prescribed him. It's called hydrocodone/acetaminophen, and there is nowhere on here that it says that it's an opioid. My son said, "Oh, I'm not going to take that. It's an opioid." And I said, "No, it isn't. It doesn't say that anywhere here. It doesn't." So my son, who's nearly 30, no, he is 30, was smart enough to know this because he looks stuff up. But, you know, it's the doctor should not really have prescribed this for a sprained ankle. It hurts, but, you know, it always used to hurt, and we didn't prescribe opioids. So it's partly the doctor overprescribing, but it's also partly all of us who don't talk to our kids about pain and say, you know, pain goes away after a while, and you can tough it out. We demand stuff from doctors, and they give it to us. And if we stop demanding, oh, I need more pain, it hurts too much, you know, really, I think all of us, or a lot of us, have had excruciating pain from back pain. And you'll do anything to get rid of it. It's just, it's horrible. You can't sleep, you can't, everything you do hurts. So I understand how people who go through pain for a long time can get addicted to this. It's not that they're morally deficient, it's that they're in pain. But let's talk to our kids about pain, and let's not demand physicians give us more pain pills. That, you know, we don't need to have so many opioids floating around, and it's partly us and partly doctors and partly the drug companies. But I thank you for taking this on, because it's a terrible problem that's just sort of snuck up over the last decade. And anyway, thank you so much.
And we are partnering with Boulder County Public Health. We've started having some meetings just recently, Thursday, and that was one of the discussions about how to reduce this. And I can tell you, over my career in detectives, we went on many an overdose death just on hydrocodone. So, and we've seen misuse and a variety of different cases. I should say many, but, you know, 2 or 3 are more than enough in your lifetime.
Well, thank you.
Thank you, Council, and there you have it. But I also want to make sure that we acknowledge all those folks and the agencies they represent who came and spoke tonight. They're all incredible public servants. They work in a difficult arena with a population that is struggling, and they've been doing it for a long time, and their hearts are in the right place. And I hope you were you felt like you got the awareness and education you needed to get tonight around the status of opioids and heroin in our community.
Absolutely. Thank you.
Mayor, Council, if I can, one of the things that I also wanted to talk about in light of Council indicating how can we be part of this process, and one of the things that Council did talk about, and we've talked about it in terms of our retreat that we're going to have next year. And if you'll remember, one of the items that was on that agenda was, it was an item that was related to mental health, substance abuse, and homelessness. And one of the things that Karen, Roni, and Mike are working on is a different perspective in how we look at this and how we engage it from an organizational standpoint, but also a community standpoint. In that the one thing that we know is that there's not one organization in the community or any one individual or department that can address these issues. And so we will expand upon that conversation during the retreat, because I think that is the venue where Council can definitely get involved as we look to the future and how we address these issues. So just wanted to preview that conversation.
Thank you. All right, let's take a 5-minute break.
I would say one thing first before they leave.
Okay, good. Councilmember Peck?
Before everybody leaves, I just want to remind you that if you do have drugs that you don't use because you don't need them any longer, you can always drop them off at Walgreens. They now have a pill disposal.
Awesome.
Don't let us down, Rigo.
Yeah.
Have I ever?
Hey,
Sure, you have not.
could we resume our meeting, please?
How you doing, Joe?
That will last. That will last.
You new at the city?
New with working with Rigo, but I was kind of the behind the scenes person until now.
We're just throwing you out there now.
Yeah.
Good luck with that.
Thank you.
So Rigo Lee is Public Information Officer, will review our survey final results.
Thank you, Mayor. My name is Rigo Leal. I'm the city's public information officer, and I'm here to introduce Ashley Perez de Tejada from the National Research Center. She will present the results of the 2016 City of Longmont Customer Satisfaction Survey. But before I turn the mic over to Ashley, I want to remind you that the City of Longmont has been conducting this survey since 1996. For several years, it was a year-to-year survey, but since 2004, the survey has been conducted every other year. This is the 16th survey since 1996. Longmont is fortunate to have this consistent baseline of data because it allows us to monitor changes over time. Survey data is much more valuable when you can compare it to previous findings, so Longmont is lucky in that regard. The survey was mailed to 3,200 randomly selected Longmont households in August 2016 and distributed equally among the 3 city council wards. A total of 806 completed surveys were returned for a response rate of 26%. The margin of error around results for the entire sample is plus or minus 4 percentage points around any given percentage. I want to acknowledge the National Research Center for their hard work. I've had the privilege of working with them for many years, and the quality of their product is always excellent. I want to thank Chelsea Farson, who is a research associate from NRC, for her work on the survey. Unfortunately, she cannot be here tonight. I also want to thank Ashley Perez de Tejada, who's also worked on the survey, and she is here tonight to formally present the survey results to the City Council and to the public. Ashley?
Well, thank you, Rigo, so much for the very nice introduction and the kind words for National Research Center. Thank you, Mayor and Council, for your time this evening. Chelsea is disappointed she wasn't able to be here, but I am anxious and excited to share with you the results of the survey. Rigo did a great job of introducing me, but I am a survey consultant with National Research Center. We're a firm located in Boulder, so just down the road. And though I said I was behind the scenes, I did work collaboratively with Chelsea on this survey, so I do have a good understanding of the results. And so with that, I will go ahead and jump in. But before I do, I also want to give another special thanks to Rigo for all of his hard work, all the years that we've worked on the survey. He's been integral in coordinating this and specifically for tonight as well. So we appreciate that greatly. So just to reiterate a little bit of what Rigo already said, I won't spend too much time on this slide. We did mail to 3,200 residents. That was an increase of 200 residents mailed this year than in previous years, and I believe that was in an attempt to get a response rate closer to what we've seen in previous years. We did receive 806 completed surveys back, which resulted in a 26% response rate and a 4% margin of error. The results were weighted to ensure that they were representative of the community, and we compared the ratings that were received in Longmont to 2 sets of benchmark comparisons. The first was to our national database, and the other was to other Front Range communities. Overall, Longmont has received similar ratings between all of their survey years, but particularly between 2014 and 2016. And oftentimes you'll find that they were similar to both the national benchmark as well as the Front Range benchmarks. And so I will point out areas in which that's not the case, but the trend is definitely stable, and that's what we like to see. And so we're definitely impressed with how well Longmont is doing. So next I'll dive into some of our key findings. And I will mention in advance that we do have quite a bit of stuff to get through tonight, so I'm not going to spend too much time on each individual slide, but I would like to open up the opportunity for council to ask questions as we're on the slide. So feel free to interrupt me if you have questions about the information there. So the first key finding that we have is that residents continue to value Longmont as a place to raise a family. And evidence of that is first in the ratings for Longmont's overall quality of life. You can see that roughly 8 in 10 residents rated the overall quality of life in Longmont as excellent or good. That has remained fairly stable through time, but has shown a pretty steady upward trend, which is great. And again, this rating was similar to both the Front Range and national benchmarks.
Meaning that,
Councilmember Bagley.
thank you, Mayor Coombs. Meaning that most cities say that they're 8 out of 10, or 8 out of 10 people will say their cities are an overall excellent or good place to raise a family?
That the overall quality of life is excellent or good in their community.
Gotcha. So we're normal or average, loving where we live.
Exactly.
Okay.
Yep.
We're way above average.
That's true, but everybody thinks that, Mayor.
So in this next slide, you can see that additionally, roughly 8 in 10 residents also rated Longmont as a place to live, as a place to raise children, and their neighborhoods as places to live as excellent or good. This, again, was similar between 2014 and 2016 and similar to both sets of benchmarks. Additionally, resident loyalty is fairly high in the city of Longmont. 9 in 10 residents said that they were somewhat or very likely to both recommend living in the city and intended to remain in the city for the next 5 years. This, again, was similar to responses given all the way back since 2010, so steady trend there, and both responses were similar to both sets of benchmarks. So the next key finding that we received from the ratings is that community characteristics have improved over time. So the 3 characteristics that you see there, paths and walking trails, recreational opportunities, and air quality, are the 3 highest rated community characteristics in 2016. Paths and walking trails did improve between 2014 and 2016 by a significant amount. It was 12 percentage points up from 2014. Recreational opportunities also trended upwards between survey iterations and was up about 6 percentage points. And although air quality remained stable over time, it made the top 3 community characteristics. Furthermore,
Councilmember Bagley, do you have a question?
Thank you, Mayor. Just real quick.
Sure.
Those same stats for the 9 out of 10 prior to 2010, what was the survey result for saying that it was an excellent or good place to live and with an overall quality of life that they approved 9 out of 10? Was it, do we have stats prior?
We do. Let me just pull it up in the report for you really quickly.
We kind of view that as your like overall grade. So I'm just wondering how much we're improving.
And you're asking about the recommend and remain slide?
Yeah, that one.
This one?
Yeah.
So in 2010, 85% said that they would recommend living. 2012, it was 87%. 2014, it was 86%. And in 2016, it was 88% for recommend.
Do we have anything prior to 2010, like going
Not
back to
for this
1990?
particular question.
Okay, all right,
Yeah.
thank you.
Would you like to see the stats for remaining as well?
Sure, thank you.
Okay, yeah. In 2010, it was 85%. In 2012, it was 86%. In 2014, it was 87%. And in 2016, it was 86%.
Okay. Councilmember Moore?
So most of the numbers you just gave us, though, are within the margin of error, is that correct?
That's correct.
Okay.
Any other questions before I move on?
No.
Okay. So the only other item I wanted to point out on this slide is that paths and walking trails within the city of Longmont did receive ratings that were higher than the national benchmarks, that they were similar to the Front Range benchmarks. Trend-wise, as I've already mentioned, paths and walking trails increased. However, additionally, the overall image and reputation of Longmont has increased over time. Job opportunities and recreational opportunities were also trending items upwards in 2016 compared to 2014. However, there were a few decreases, which included the availability of affordable quality health care, affordable quality child care, and affordable quality housing. This is something that we're seeing as a trend, not just in Longmont, but in the Front Range overall. I don't think it's a surprise to anybody, these items, given the influx of population we've had to Colorado. And so from our experience in working with other communities in Front Range, we're definitely seeing these sorts of things. So the third key finding is that residents seem to be willing to pay for transportation issues. First, to give you some statistics about traffic and transportation that were on the survey. The first graphic that you see there is from an open-ended question that the survey asked, which residents were allowed to write in their own words what the 3 biggest challenges or problems Longmont was facing in the next 5 years. And 2 in 5 stated that traffic, transportation, and parking was one of the main problems. That second figure there demonstrates that around 7 in 10 residents believe that traffic congestion is at least a moderate, if not major, problem within the city.
Councilmember Moore.
Thank you, Mayor Coombs. On these open-ended questions, do they still score in the same margins of error as they do on the multiple choice questions, or is there a different way to look at these versus you've only got 4 answers, so you got to pick one? Whereas if you can just write in your own answer, that's a lot of traffic, transportation, and parking issues. A lot of people feel that's important.
That's correct. And so the way that we analyze those open-ended questions, particularly with the 3 biggest challenges, is we usually take the first 3. So if people list 6, for example, we would list the first 3, but then we code them out to several topic areas or themes. And we'll get into a little bit more of the other open-ended responses that had higher responses related to other things. But in general, they're broken out by themes, and all the verbatim responses are provided in the report, so you can see verbatim what people were saying with respect to these items. Does that answer your question? Okay. So again, related to transportation, we're seeing a number of trends. Several increased over the course of the 2 survey iterations. Ease of travel by car and by bicycle as well as bus all increased over time. And in the meantime, the amount of public parking ratings have declined between 2014 and 2016. The ease of car travel, although it has increased between the 2 survey iterations, was marked as lower in Longmont than in the Front Range communities, but was marked as similar to communities nationwide. So in a couple questions related to transportation and taxes, this question was new to 2016, so there's no trend data, but the first question asked, or I guess the question asked, to what extent would you support or oppose the following? And 3 projects were listed. The first was free local bus fare. The second was snow plowing during every snowstorm. And the third was eliminate trains sounding their horns. And residents most strongly supported a permanent increase of the street sales tax by 1.4 cents on every $100 spent to have every local bus fare paid for. A similar percentage, however, supported a permanent increase to the street sales tax by 10 cents on every $100 spent to have every street plowed during every snowstorm. And we'll get more into the policy questions towards the end of the survey. There were many on the 2016 survey. But it's important in these cases to look at the strongly support section as opposed to we often will combine the 2 positive responses. And that's because the folks that are in the somewhat support and somewhat oppose categories are the on the fence folks. And so if you were looking to see how it would fare on a ballot, for example, you'd really want to look directly at the strongly support section. So our 4th key finding are that residents are engaged and invested. First of all, they feel that the ease of obtaining information in Longmont is at least somewhat, if not very easy. About 9 in 10 stated that, and that has remained stable over time, as you can see. Furthermore, residents were asked about which sources of information they typically use to gather information about the city. 9 in 10 stated that most of their information comes word of mouth, either through family and friends. About 8 in 10 thought that most of their information about the city came from the website, the newsletter, the Daily Times Call newspaper, and the Longmont Recreation brochure. These sources were listed as the top 5 most frequently used sources, but there were 38 total sources of information provided for them to rate. If you'd like to look further at all of the available sources, that can be found in your report on pages 15 and 16. The least used sources of the 38 on the survey were Channel 16 Government Access, Behind the Badge on Public Access Channel 8, the City Council meetings on Channel 8, and attendance of the physical City Council meeting.
Let's go home.
Councilmember Christensen.
Thank you. I think this is a dandy report here. It's full of all kinds of odd information. But I'm having a hard time understanding the difference between Figure 8 and Figure 9. And sometimes they contradict each other, apparently. For instance, use of word of mouth by friends in Figure 8 is like increasing over time, and it's up to 88%. But on the chart on Figure 9, it's also increasing, but from 17 to 20%. Isn't it the same thing? I mean, aren't these the same thing? How are they different? And also on this, I must point out that the readers of the Longmont Daily Times are increasing. Oh, no, they're not. Sorry. But it's still like 25%, so that's... But anyway, what is the difference between the two? The titles are similar, but not the same.
I think that what is happening in Figure 8 is you're seeing responses of people who have used the source at all. And so that's combining the very infrequently all the way to very frequently.
Oh, okay.
And then we've done it again in Figure 9 to show only the very frequent use, so the most used sources.
Okay. I understand the difference then. Thank you.
Yeah, I can understand how that's confusing. Great question. So much to what you were already asking, these are trend items of the sources being used over time, and you can see that a lot of them are trending upwards, and that includes the Boulder Daily camera use, social media site use, and watching meetings and attending meetings. You'll be glad to know, Councilmember Bagley. And the only item that has decreased over time is the city talk.
I have a question.
Councilmember Finley. Susan.
You have on your slide reading the Boulder Daily Camera. Does that include the local Times Call paper as well, or just the Boulder paper?
Councilmember Finley, we distinguish the two publications in this particular question.
I'm sorry, I didn't hear which two sources you were asking about.
The Longmont Times Call as opposed to the Boulder Daily Camera? The Longmont paper as opposed to the Boulder paper?
So yeah, I think on page 16, the Daily Times Call was used very frequently by 24%, and then the Boulder Daily Camera was used frequently by about 7%. But in this slide, the Boulder Daily Camera is specific to Boulder, I believe. Is that your question?
Yeah. I guess your question was, why isn't the Longmont Times Call slide or data shown on this either going up or down? There's no line here.
Oh.
This one shows greater usage over time, except for the one, except for City Talk.
Okay.
Yeah, so this is just showing significant differences between the years.
Okay.
And so if there was no significant difference in the trend, then it's not included on this slide.
Got it. Thank you.
Uh-huh.
Councilmember Moore?
Use the term significant difference. How is that calculated?
Absolutely. In this case, I believe the difference between years is 6%, and it is calculated based on the number of responses this year versus the number of responses in 2014.
So not a statistical calculation.
It is a statistical calculation. I just don't have it off my brain, but I can tell you that it's calculated based on the number of responses each year, and that the difference is 6% in this case. I could certainly, if you'd like me to give you more details about this after the presentation, I can send that through Rigo and he can give you that information. All right, so also demonstrating high engagement in the city of Longmont and investment of the residents. Nearly 9 in 10 said that they were somewhat or very likely to vote in the municipal elections. This was a new question to the 2016 survey, so there's no trend data on this one, and this one was not benchmarkable. So the fifth key finding is that respondents are concerned about cost of living in the city of Longmont. And so the good news is that the economy ratings within the city of Longmont have increased over time. Roughly 6 in 10 positively rated Longmont as a place to work, and roughly 4 in 10 positively rated the job opportunities in the city of Longmont. Both were similar to both sets of benchmarks in this case.
Councilmember Bagley?
Thank you, Mayor Coombs. For 2 questions. One, what's the difference between asking, is it a good place to work, and are there job opportunities? I mean, I don't understand the difference between the questions.
Absolutely.
And then the second question I have is, this is just perception, correct?
That is correct, yes.
Okay.
So
all
we
right.
don't often get at the why.
Okay. So that's, I guess, what I was asking. Thank you.
Yeah, absolutely.
Did you get at the why? No. So what's the difference between those 2 questions?
I think it is a nuanced difference, but place to work is for those who actually work within the city, and then job opportunities are for those potentially searching for jobs within the city and whether they're available or not.
Thank you.
Mm-hmm. So as it relates to perception of job growth within the city of Longmont, roughly 6 in 10 said that the speed of growth was much too slow in this case. And fewer residents in Longmont believed that the growth was too slow when compared to other communities in the nation, but it was similar to what was seen in the Front Range communities. Furthermore, as I mentioned in an earlier slide about that open-ended question, Councilmember Moore, I think you were interested in this. 1 in 5 stated that economy, jobs, and cost of living was one of the 3 largest challenges or issues in the community. Additionally, around 3 in 10 residents said that the shopping opportunities were excellent or good in the city of Longmont, and Longmont as a place to shop also received about 3 in 10 positive responses. Over time, both of these ratings were stable. However, shopping opportunities were lower in Longmont than both the national comparison as well as the custom benchmark comparison in the Front Range.
That'd be 10 out of 10 and 5 out of 5 with the Nordstroms in town. That's skewed.
Longmont as a place to shop did not have a benchmark, but again, it did stay stable over time. And roughly 2 in 5 residents believe that the retail growth in Longmont was too slow or much too slow. However, they also said that more residents were saying in 2016 that the retail growth was the right amount than they've said in previous years. Another new question on the 2016 survey sought to learn the extent to which residents were worried about potential concerns in their household. And so what you're seeing there is about 6 in 10 residents or more were most concerned about unexpected costs such as car repairs or health and dental insurance. And roughly half or a little more of residents were worried about housing costs and either finding a job or finding a better paying job. There were a list of 12 concerns that they could rate in this question, and childcare was listed least of the concerns. However, it's important to note that roughly 2/3 of the people that responded to that question said it was not applicable to them. So our sixth key finding is that residents think highly of city and customer-provided services. The overall city services ratings was very positive, with about 9 in 10 rating it excellent or good. This again represents a stable trend in resident opinion over past surveys, and this rating was similar to both sets of benchmarks. Of the city services that could be rated on the survey, the highest rated ones were firefighting and rescue, sewer, weekly trash pickup, library services, and electric services. But other highly rated services included recycling, emergency police, fire inspection, and tap water. All of these services were rated positively by at least 8 in 10 residents or more, and generally were similar to both sets of benchmarks. Trend-wise, we've seen some increases in ratings for emergency police services, youth services sponsored programs, crime prevention, and traffic signal timing. The couple decreases that we've seen between 2014 and 2016 were the electric conservation programs and plan review. Generally, again, these were similar to the benchmark. The only item that was lower in this case was the museum. In total, residents could rate 36 services. 34 of those were benchmarkable. And if you'd like a list of all the services that could be rated, that can be found on page 23 and 24 of the report. Residents were also asked if they had contacted the City of Longmont in order to request services within the past 24 months, and that included to contact police, fire officials, parks, recreation staff, receptionists, planners, or any others. What you see on the left-hand side is that about 6 in 10 reported that they had contacted the city to request some form of service, and this proportion was higher than what was reported in 2010 and 2012, but was similar to what was reported in 2014. Of the 27 departments for which a resident could contact for service, respondents were most likely to have done so for the Next Light broadband service, with about 4 in 10 respondents indicating that they had contacted for that reason. About 1/3 had contacted the city regarding utility billing or police services, and about 1 in 5 had contacted the city regarding the electric utility or recreation services. Few, if any, had inquired about services related to airport services, forestry services, or city attorney prosecutor. Most of these rates of contact were similar between surveys. However, fewer reported contacting the city about utility billing in 2016 compared to 2014, as well as for recreation centers, library services, and on my next page, trash and recycling services. Next Light broadband services was new to the 2016 survey, so there's no trend data for that. When residents were asked to reflect on their contact with the city when they made those contacts, most residents, about 8 in 10 or more, rated their interaction favorably. Longmont residents approved of the performance of city employees, with about 8 and 10 or more rating all aspects of employee engagement as excellent or good. So they felt like they were treated with respect. They felt that the employee was willing to help. They were knowledgeable, and they handled the issue quickly, and they were easy to get in touch with. When compared to 2014 ratings, most impressions related to staff interactions remained stable over time. The only exception to this was the ease of getting in touch with city employees, which declined slightly between 2014 and 2016. Where benchmark comparisons were available, most ratings were similar to both sets of benchmarks, but the overall impression of the city employees for the residents who had contacted them was rated higher in both the national and in the Front Range benchmarks. So our seventh key finding is that affordable housing and growth are definitely top concerns among Longmont residents. Once again, we come back to that open-ended question about the top 3 challenges or problems facing the city in the next 5 years. And the number one answer in this context was growth, overpopulation, and planning, which was stated in some form by 46% of residents. If you would like to see the full verbatim responses as we discussed earlier, that's on page 84 of the report. Additionally, roughly 7 in 10 residents have stated that the growth in Longmont is either somewhat or much too fast, and that is a steep increase from what we saw in 2014. And more people in Longmont than in communities nationwide and in the Front Range also felt that it was too fast.
Councilmember Moore?
Actually, on the previous slide, the 71%, is that, I might have missed it, did you say similar to other perceptions, other Front Range communities?
That was...
Perception to population growth?
Yeah, more people in Longmont, so it was essentially higher than the benchmark, but more people in Longmont felt that the growth in the city was too fast. So this question was asked in communities nationwide, and more people in Longmont felt it was too fast than other members did in their communities
But on a nationwide scale?
And in the Front Range as well.
Okay, thank you.
Yep. Furthermore, roughly 2 in 10 felt that the access to affordable quality housing was excellent or good. This item did decrease between 2014 and 2016 and was found to be lower in both the national comparisons and in the Front Range comparisons.
Councilmember Santos.
Thank you, Mayor Coombs. And if I'm not mistaken, we didn't quantify what affordable quality housing means, did we?
We do not quantify. It is left fairly broad, yes.
Thank you.
Mm-hmm. So when asked about a couple additional policy questions, support for taxes to build workforce and senior housing, roughly 6 in 10 supported a temporary sales tax, and fewer, about half, would support a permanent sales tax. The question asked, Longmont is currently facing a shortage of rental housing that members of our workforce, as well as our disabled and older adults, are able to afford. Many families are unable to continue to live in the city due to the cost of housing, both for sale and for rent. To what extent would you support or oppose the following approaches to publicly fund the construction and preservation of workforce and senior housing? And so that first option, that temporary tax option, was to dedicate a sales tax increase of 5 cents on every $100 spent to generate $1 million annually, which would expire after 10 years. And the second option was to dedicate a sales tax increase of 2.5 cents on every $100 spent to generate $500,000 annually, but that would be a permanent tax. Again, here, I'm not showing the full frequencies, but roughly a third of residents strongly supported each of the measures, and you'll see a similar percentage strongly opposed. So that's another difficult one to say if it were a ballot measure, which way they would go. And we'll get into that again further with the other policy questions.
Councilmember Bagley.
Thank you, Mayor Coombs. So it's a couple questions. 2.5% per $100 on the 54% permanent sales tax. And then what was the amount of tax on the temporary sales tax?
5 cents on every $100.
5 cents on 100. And then just out of curiosity, which this is the first time, this is the only question that really made me think, have you done any research, or do we know what type of people will respond to the survey? Meaning our community, my opinion, which means nothing, I just observe it seems like people who would support taxes to build workforce and senior housing also are the most engaged in our community.
Certainly.
And so my question is, this makes me think, of the 806 out of the 3,200 that responded, for example, 87% are likely to vote, right? How many of the people who didn't respond, are likely to vote? And I guess what I'm saying is this an indication? Is there a correlation with all of Longmont? I don't know how to ask it, really. I guess what I'm saying is the data skewed towards people who lean Democrat? I guess is what I'm asking.
Sure. It is certainly a question that comes up frequently. However, the methods in which we use to conduct the survey is done randomly. And so the reason why we do that is because we're trying to get a representative view of the entire community. So in short, it is not likely skewed in one way or the other, because we're not asking people who are normally the whistleblowers or the people who are at the council meetings, saying something every week. These are people who potentially don't get to say anything or have an opinion, and they were able to give it on our survey. Mm-hmm. So
if I can jump in, I think also she said something to answer your question. So you had, 30% that strongly supported and 30% that strongly opposed. Can you go back a slide?
Oh, absolutely.
Kind of get at what you're looking at in the population and what you're asking. So in that number, you had 30% on each end of the spectrum.
That's the other concern. Earlier, your comment was sorry.
Go ahead, Councilman.
Thank you, Mayor Coombs. We don't need you, Mayor. Just hold on. That was my next question. So earlier, your comment was, if you want to look how something's going to do on a ballot, you're saying it was 30-30. You said look at the strongly support and strongly suppose, but this data here is combining
percent positives.
It's combining it. Mm-hmm. And you were saying that it was 30-30 on both? What was the strongly support and strongly oppose on each of these?
So exact percentages on the 5 cents was 30% strongly support, 26% strongly oppose. And for the 2.5 cent tax, it was 26% strongly support and 30% strongly oppose. So again, it's hard to say how things would fall if this actually became a ballot measure. But as we get into the policy questions, I'll kind of allude to ways in which perhaps other data can inform this and help us get to a more conclusive answer about this.
Thank you.
Mm-hmm. So as I've mentioned, this survey contained a lot of policy-related questions, several of which we've already gone through. The next one was related to a limited retail sale of recreational marijuana in the city. And the question asked, to what extent do you support or oppose the limited retail sales of recreational marijuana in the city of Longmont? And once again, here we see sort of a difficult breakdown to discern how people would vote on it. Strongly support is about a third, strongly oppose is about a third. If there are other pieces of data that maybe can inform these things, or if there are ways in which the city can communicate with the community, it's possible that they would feel more confident about what they're actually voting for in this case, and you would see the people that are on the fence, the somewhat support and the somewhat opposed folks, going more towards the polls. So they would be more distinct about their opposition or their support for these policy questions.
Well, one thing about this question that's different than a sales tax is, when people are actually going to vote on a sales tax issue, they oftentimes don't vote as strongly as what the polls say, because it's real money at that point. It becomes more real than just answering, but this is not a sales tax issue. It's a policy issue. So it's different how you interpret the spectrum, how you're trying to predict, because it's not a sales tax increase or decrease. So
I agree. I think that's a really great point. And I think when it relates to these questions too, however, there are still potential consequences that people think may come out of something like this. So while I completely agree with what you're saying, having more information available will still help delineate these lines, even if tax money isn't involved in the question.
Right. Okay.
So the next question was related to rehabilitation of city facilities, and the question asked, to what extent would you support or oppose issuing new bonds with no new taxes to pay for the rehabilitation of city buildings and facilities at an approximate cost of $35 million? And in this one, we see a more interesting breakout in that almost a quarter strongly support it, but a huge chunk of folks are in the somewhat support group. So in this case, it might be that more people would go to the strongly support side just because of where they're falling. And more importantly, only about 1 in 10 are stating strong opposition to the measure. So this one, I think, is a little bit clearer than some of the other ones that we've asked. The next policy question asked about recreation facilities funding. And so the question asked, to what extent would you support or oppose increasing sales tax, if needed, to construct and operate the following recreation facilities? The cost of both of these were estimated to be about the same. They were between 30 and 35 million. And once again, we see almost identical percentages with respect to support and opposition of these. So it's difficult to say, how it would go if it became a ballot measure. I'm not sure if there's other data points that might help inform this, the recreation facilities funding. Finally, the last policy question was related to eliminating train noise, and I alluded to this question before with respect to the 3 projects. The other were free bus fare and snow plowing. And so as it relates to train noise specifically, roughly a quarter strongly support eliminating the train noise. And so again, we have this sort of tough breakout. We have around a third who strongly oppose it. We did do a cross-tabulation of data of those who stated that they felt that train noise was a major or moderate problem in the city. One can probably easily see the connection that if they thought it was a major or moderate problem, they were more likely to support eliminating the train noise. But again, of the 3 projects, this was least likely to gain support. But again, in the end, we have relatively equal distribution of support and opposition, so it just may require further digging with respect to approaches on informing the public about what all this entails and helping people become more confident in how they would vote in these cases.
Councilmember Moore?
Maybe the question should be eliminate trains?
So that's pretty much it for me. Does anybody have any additional questions?
Councilmember Peck?
Thank you, Mayor Coombs. Just out of curiosity, if we were going to use this survey to put questions on the ballot, do you think this is a good representative? I mean, we're only 803 or 5 people that responded. Is that a good benchmark as to whether it would go on a ballot or not? That's not very many responses from a 90,000 populated city. What do you think?
Sure, it's a great question and one that comes up often. Ultimately, all of our survey processes and methods ensure that even though we received a limited response, it is representative of the full community. And so I think whether it becomes a ballot measure or not reflects also on the fact that the distributions of support and opposition are so hazy. And so with respect to your immediate question about is it representative and therefore should be a ballot measure, yes, the survey is representative of the city of Longmont. But as far as how we could tell where they're going to go, how they're going to vote, that's a more difficult question to answer.
Okay, thanks.
Councilmember Peck, if I could add just a little more information to that. In prior surveys, we've taken an approach. We've asked questions that we think we may want to ask on a ballot measure. And in some cases, the results were pretty close to what the actual vote came out to be. So there's some history there for us in that regard. But another piece of that is that we asked the question exactly how it would appear on the ballot as well. So the way the question is asked here may not be exactly the way you'd ask it on a ballot. So it might change the response as well. So if you wanted to make those kinds of decisions based on a survey, I think you have to be pretty careful about it. Ask the question almost exactly the same way. And also, I would caution using any one piece of information to make any kind of policy or judgments. You receive information from all sorts of places, from constituents, from studies from other cities. I think this is one piece of the greater information puzzle, and so relying solely on it I don't think is the best thing to do. But again, we do have some history on where it is effective.
Councilmember Christensen?
I guess I want to revisit what Councilman Bagley said briefly. Of the 800 some responses, did they come back equally from all the wards, or were they? For instance, my ward, Ward 2, seems the happiest. But did they come back about evenly, or were they? Was one ward more overwhelmingly coming back than another?
Great question. Let me just take a quick look. So we received a response rate of 28% in Ward 1, a response rate of 22% in Ward 2, and a response rate of 28% in Ward 3.
What was Ward 1?
28%.
28.
We're happy.
Yeah.
And what was Ward 2 again?
22%.
So we
Ward
came
2.
back less. All right. The other thing I guess I would like to comment on, which we didn't discuss, but it appears from the survey, which is what I would expect, that about half the town is actually worried all the time about finances, which is certainly true in my case, and I think it's a sad thing. But,
It's a difficult thing to, again, across
It's
the Front
nationally,
Range.
though. Yeah.
Nationally and particularly in the Front Range.
Yeah, right. Thank you. I think this is very interesting.
Councilmember Moore?
Thank you, Mayor Coombs. So just a question about the way the data is displayed in the tables of numbers. Some of the cells are grayed and some of them are white, and it seemed to be a random, and I couldn't really understand what was going on there.
So I think what you may be referring to is perhaps the cross tabulations near the back of the report where there are grade cells. That is denoting significant differences, so that's where we're ensuring that we've run the statistical analysis and there's nearly no chance that the difference happened by chance. And so only where there is grade cells was there a significant difference between those groups that are being compared.
Okay, that'll help. I'll go back through it.
Yeah, it's very helpful, but there's a lot of information in there.
Councilmember Bagley?
Thank you, Mayor Coombs. I guess the reason, an observation rather than a question, it's what strikes, the reason it just compounds my earlier question or doubt or concern that who's responding. And I mean, just an observation, it seems that, and I appreciate your comments, Rigo, because yeah, you got to be, I would agree that you have to be careful, because the data, this data would basically support, at least if I'm hearing right, that our community in general would support things like, I mean, even though they're worried about their finances, that's what I'm hearing a lot of, they nevertheless would support a tax for transportation and free buses and affordable housing and senior housing. So I mean, are these people with money that are saying we want to tax? Or are these the people that are needing services that want to tax? Meaning it's the same people that are saying let's tax don't want to tax for a recreational facility. So it just doesn't, the data, I guess I question the data. I've got some concerns about the data. In a past life, I worked in data up to my eyeballs. And so just, I guess I have questions. It's surprising that people who would say I'm worried about my finances would also say tax us more, unless those are the people that want the services, which leads me to believe or question who's responding to the survey, if that makes sense. I guess in the future I'd like to see some type of question about income, political affiliation. I'd want to know who's responding. You know, not necessarily where you're living in which ward, but who are we collecting the data from? Who's more likely to respond? Is it the happy person that I'm so happy I want to respond? Or is the happy person saying, you know what, I really don't have time for this. I'm too happy. I'm going to the rec center. I'm going to work. You know, so I want to know. I just want to know who's giving us the data. We've got 93,000 people. I just want to make sure that we're getting a nice cross-cut from all folks.
And so the nice thing is that we actually provide demographic information on who's responded towards the back of the survey, so that gives you direct information. You want to check it out?
Yep.
Okay.
What page is that on?
Actually, I can help you there, too.
Councilmember Finley?
Thank you, Mayor Coombs. There's a big difference in who responded to our survey and those that actually do vote in Longmont. If you look at the demographics of those who actually vote or actually voted in the last municipal election, they're much older than the respondents to this survey. So a political survey or a survey that you would want to do prior to putting out a bond election to see if it would pass, you would want to have more an older demographic in that to see if it would pass, because the older people vote more in Longmont. This survey isn't meant to do that. It's not like a political survey that would have that information in the correct numbers to be statistically valid for that kind of information.
But again, some of these things weren't intended to decide whether we're going to go out for ballot. There was just getting information, you know. But I agree, if we were going to, you know, if we're like a school district and we're worried about is our bond going to pass, then we would send those surveys out basically to the people that voted, the most likely voters, because otherwise you're wasting your time and effort, because, you know, most 30% of people don't vote, so why send them the information if they're not going to be voting?
Hey, Mayor?
Yes.
Mayor, Council, as actually you touched on what I was about to touch on, is that as we look at some of these issues over the next few months, one of the things that we will be talking to you about is how do we want to go out and research it, and do we want to look at a different type of survey to take more specific language potentially where we can define things better. So that is an option that Council will have as we start engaging in general discussions about a lot of these issues.
Councilmember Christensen.
I wanted to ask you, too, since this is your field, what is your opinion about sending these out versus online surveys? Do we get, is there generally more, these days, more response from online surveys? And do you find those as valid? Or what would be the difference to you? To me, at this point in time, it would make more sense for us to be sending these out digitally. But
sure. If you don't mind, I'd like to just take one quick step back, because I don't think I've finished answering Councilmember Bagley's questions. The demographics begin on page 41 of the report, if you want to look at that. It's Appendix A, if you have a navigation that you can click right to it. But beyond that, too, that's the other benefit of the cross-tabulation report, because it gives you the breakout of the differences between those demographic groups. So you can see, younger respondents said X about this particular rating and that sort of thing. So I think that will get more directly at what you're asking. And again, back to dovetail what Rigo said, this is one tool in your toolbox, and while we pride ourselves in our methods and our surveying knowledge over the course of 20 years that we've been doing this, it certainly is not the end-all be-all, and it just is meant to work as another tool among all your many tools to help inform all these different decisions. But Councilmember Christensen, back to your question, which is an excellent one. We prefer the mailed version of this because we are able to do it randomly, and that's how we're able to get the random sample and the weight to make sure that it's representative of the community. We do see a trend in survey research that is going from mailed to a more online web version, but what we actually offer, and what we did this year too, is we mail the survey, but we give the option to people if they want to take it online to do that. And what's strange is that while we certainly are heading in a more technological kind of world, we receive, between 10 and maybe 20% responses to the online. Most people will fill out the mailed survey and send it back to us. Yeah.
And if I could add one more thing to that, several years ago, we asked that, a council asked that same kind of question, and we sort of, I think we did 2 versions of the same survey to try to compare, and I think what came back, if I remember correctly, was that there was not a significant difference in the results, at least in that one time several years ago. So in the future, we wanted to sort of do a comparison kind of approach, do it both ways and offer that, and then compare them and see what the differences are. We can also do that again sometime in the future if the council desired that. And if I could add one last thing, just getting back to a point that Councilmember Bagley made earlier about the why, and we get the why question quite a bit. And again, this survey is intended to answer the whys. We did several surveys back in the day to try and get to those answers, and we got some very interesting responses. Again, it's always council's option to modify the survey or to create a new survey, which we have done in the past. And on those off years, when we don't do the normal survey, in those off years, we have asked more pointed questions about why do you think growth is too slow or too fast, or just try to dig a little deeper in those cases, and actually have the results of some of those or all of those if council is interested in seeing those too. Again, they're a few years old, but they probably still have interesting information if you'd like to see those. Again, just keep in mind that if at some point you want to add that to the off-year survey cycle, we can do that too.
I don't see any other questions. I think it's time to move on to public invited to be heard.
Thank you all again for your time. Have a great night. And happy holidays.
So, Carl Strope.
I did not prepare. Oh, my name is Carl Strope. I live at 1184 Winslow Circle. I did not prepare these words in light of the opiate and survey, but they seem very apropos. I have a few written words I would like to present to this audience. When I use the demonstrative this, I refer to the bifurcated nature of the audience, firstly being you, the council, as one representation of the people, and then more thoroughly, the people who hear these words as a record of our, and that's a self-identifying political unit, our Longmont political process. I adhere to the substantial nature of words and that those make up the political process. However, I do not intend these words to be directly any call to some action, but only to further the possibility of meaningful discourse. 4, I would like to present to you, the City Council, that it is not in Longmont's best interest to further accommodate or anticipate self-storage as a worthwhile land use policy at all. I'm not so much concerned with the plans and appeals under consideration tonight, that is the firehouse dealio, but with the continued support of self-storage as a viable industry, kind of just over. I state this as my political goal to reveal this practice as wasteful and short-sighted, for I do not believe it serves the people generally, and to the people of Longmont, I say we do not need more self-storage. When Holderlin wrote about the difficulties of free use and what is appropriate, we are not inclined to think of something so dreary as minute planning bureaucracy. But I declare that nothing is more appropriate to us than where we live. And when I say where we live, I'm not concerned with the people who have property here and the people who are tied down and the people who have a lot of that kind of stuff, because property doesn't reflect a citizen any more than a man's wealth reflects thereby his virtue, which is to say none at all. I would argue to your City Council that your powers in appropriating the law is to serve us, and that is the people of Longmont, but you in fact failed to do so. For we do not fit inside that reasoning. This survey, I don't know how that works. We don't fit in it. We need more housing. We need jobs. We need schools. We don't need more self-storage. That's a bad waste of our precious city. There's more I can say, but I'm running out of time, and I just want to say that we keep going, and we need to stop and reflect about who we're talking about when we talk about Longmont, because a lot of us don't have a voice yet. Thank you.
Thank you. Dave Cobb.
Good evening, Council, Mayor. Dave Kopp, 229 Airport Road, number 13. Last time I was here, I want to thank you because you helped me with a safety issue. I'd fought 3 different groups trying to get, this was when we were doing the rules and regulations, and the helicopter pattern work was opposite of what regular airplane traffic, and that was a real hazard, and I wanted to thank you for getting that corrected. I have another safety issue. I'm also a fixed-wing pilot, and I'm worried about the development to the east of the airport. In the last 15 years, I've seen 3 airplanes in that field, and nobody got hurt, but all 3 airplanes were pretty well totaled. I've also seen 3 off the west end as well in that 15 years. And I know the local FAA people believe that it's a hazard, the height of 34 or even 30 feet. The storage area that is east of the airfield now is 16 feet, was their maximum height, and that was, 10, 15 years ago. And so now all of a sudden we come across a 40-foot power line into a 16-foot storage area, and then the next storage area would be 34 feet. The Fort Worth FAA says it's not a hazard, but, they don't live next to the big hills where we get these huge shear layers. Big thermals. There's nothing that generates thermals better than an asphalt parking area or a storage area. It's like 1,500 feet a minute right off the end of the runway, and you're about 20 seconds from landing. And right on the other side of a 1,500-foot vertical rise on a thermal is sink, and it comes down just as fast. And so it's very difficult to try to stay out of everything. And even though it doesn't happen a lot, in 100, a million different events, we've had 6 that I've seen didn't make it. So. Appreciate your time, but and I think the process is broken on this one. At least on the rules and regulation, we got plenty of notice. We got a chance to input on it. And this one somehow slipped through the fence. We didn't see it till just recently, and I know this has been in development for years. So maybe some of you take a look at where the process fell apart. Thank you for your time.
Thank you. All right, that ends public invited to be heard. And I'll move on to the consent agenda.
Mayor Coombs, the first item on consent is Resolution 2016-125, a resolution of the Longmont City Council approving the intergovernmental agreement between the city and Boulder County for financing a bicycle shelter at the pedestrian underpass at State Highway 119 and Hover Street. Item 8B is Resolution 2016-126, a resolution of the Longmont City Council approving the Union Reservoir lease extension between the city and Union Reservoir Company. Item 8C is 9 capital improvement program amendments that were previously approved by the city manager. The action is for you to accept those. And item 8D is approved 2017 legislative agenda, including the Colorado Municipal League 2016-17 policy statement, National League of Cities National Municipal Policy, and 2017 Longmont Water Principles. Staff does not need to pull any of these items.
Okay. Councilmember Bagley.
I move that we pass the consent agenda.
All right, then moved and seconded. Let's vote. That passes 7-0.
Mayor Coombs, your next item then, since we have pulled the second reading and moved that to tomorrow's special session, is the general business item, update on water rebate pilot program. And Dale Rademacher will start this off.
Mayor Combs and members of council, Dale Rademacher, General Manager, Public Works and Natural Resources. Tonight we have just a really brief update and report back to you on the the outcome of the rebate program that we initiated this year for water customers. And Becky Doyle is going to go through a couple of slides with you on that. What I'll say in general is that the program was initiated, it launched. I believe we need to do additional work to try to get greater levels of participation in the program, and we're going to talk with you about some ideas on how to do that. So with that, I'll turn it over to Becky to go through it and see if you have any questions.
Good evening, Mayor Coombs, members of council. Let me see if I can talk to you while I also pull up PowerPoint. Okay, so in 2015, you approved a pilot program for a revamp of our rebate program. We had an existing water rebate program for low-income seniors and disabled residents, and we wanted to change that a little bit while still maintaining the general structure for people who'd been served by that for many years. And we switched that from being a 28% rebate of the total water bill in the previous year to being a rebate of the fixed charge. We did that primarily to maintain the conservation signal that is sent by the increasing block structure of our water rates. And we also wanted to expand program eligibility to all people that fall within those income levels, not only seniors and disabled residents. So this is a graph you may remember from when we initially talked about the program, and it shows our population distribution among income levels. And so we're essentially concerned about the blue and the red bubbles all the way on the left. The industry standard for water rate affordability is that it should that the water rates should cost no more than 2.5% of median household income. And so there's been a movement to sort of talk about 2.5% of any household's income, and that was sort of our guideline, was trying to limit a household's expenditures to 2.5% of income. So based on an average, the citywide average water use of 9,000 gallons a month, we could have households in the $15,000 and under annual household income paying about that level, 2.5%, and as high as 3.7% on the left there. Any questions about that? Those two bubbles together represent about 10% of Longmont's population. So we ran the program this spring and accepted applications from February through April. As we had 31 successful applications, which is very much in line with our previous participation in the senior rebate program, and only had 2 applicants that would not have been eligible under the previous program. So pretty low participation. We did find that the mean and the median rebate that were received by the applicant pool represented 29% of their annual water bills for the previous year. So again, lining up really well with that previous 28%. So we don't think that folks who've been participants in the program for a long time, felt that they received something that was out of line with where we had been. We did notice that among the applicant group, that their water use was already lower than that 9,000 gallon citywide average. This group is more around like 5,000 gallons, so they're already controlling their water expenditures through their use. And the total rebates we provided was $1,644. So based on that lower water use level, these are the two income groups that we were concerned about in the sort of $15,000 and below range. So based on the average water use for that group, they in fact are not spending above 2.5% of household income as long as they're at the top end of that income spectrum. Folks that are below $7,000 could be spending more than 2.5%. So the brighter colored bubble at the top is what the percentage of their household income was based on their gross water bill, so like what they paid throughout the year. And then the lighter colored one is how it reduced with the rebate. Next year, we are going to have some changes in utility rates. So these will impact all of our users. We're back to the 9,000 gallon water use right here. But when you look at all of the different changes, and we are at this point assuming that the majority of trash users are going to move from the 96 gallon trash carts to 48 gallon, we think that there's going to be an increase in the monthly bill of about $1.14. So, and that's just to sort of get to the point of, this famous graph where we compare our average utility bills to our surrounding communities. So this is comparing Longmont's 2017 average bills to our surrounding communities' 2016 rates, because we don't know their 2017 rates in all cases. But we're certainly below average and may even fall a few places further to the left. For folks who are having trouble paying their utility bills, there are a number of resources that are available, and a lot of this information is available on the city's website under the utility billing section. So our recommendations for now on the water rebate pilot program would be certainly to continue the service that we've offered for our senior residents, where the volunteer tax preparers help them fill out their rebate forms as usual. That we conduct some additional outreach so that we just make sure that folks who may qualify know about it. And that we may consider broadening the eligibility and increasing the income levels above maybe what the 104 PTC level is. And we should continue to review both the water rebate results and the affordability of our utility bills generally. Questions?
Councilmember Moore.
Thank you, Mayor Coombs. So Becky, does this water rebate we're talking about tonight, does that come back off their monthly bill, or is that a rebate at the end of the year?
It's a rebate at the end of the year based on the previous year's water bills.
So they still have to spend the money first to get it back?
Yes, yes, and that is a program characteristic that we held over from the previous senior rebate. So folks do receive a check in the April-May timeframe.
I guess my concern would be if households are having trouble meeting their monthly bill, is there a better way to manage that part of it?
Mm-hmm. That is a potential change. We could look at the administration cost of doing a monthly reduction is a little higher. So, and the way that it's written in the code right now, it's as a rebate so that happens one time. So we could come back with code changes if that were desirable.
I think that'd be worth investigating. I don't know that we have to, until I knew more about it, what the impact would be, wouldn't advocate for or against it yet. Thanks.
Councilmember Christensen.
I was distracted by what Councilman Moore asked, which I think was very good. Come back to me.
Councilmember Peck.
Thank you, Mayor Coombs. So, Becky, what determines, no, I said that wrong. It's a rebate, but in order to get the rebate, do they have to apply at the beginning of the year, or can they apply at any time during the year? My thought being, it might be that they don't know that they can afford it until they get to about March or April and think this is killing me. Is it too late to get into the program at that point, or do they have to do it at the beginning?
Councilmember Peck, there's currently a deadline of April 15th that coincides with the tax preparation season.
Oh, okay.
Another holdover from the previous program. But we could look at changing that potentially.
No, I think that's fine. I was just thinking because the increases start in January, so they would know at that point whether they can afford it or not. I was just thinking if they had to sign up in January and didn't, then they were kind of at a loss. Thank you.
Councilmember Christensen.
Okay, now I remember. When you this is available to anybody who pays their bill independently, whether they live in a residence or a rental. Is that correct? As long as they have a low income.
Yes.
Okay.
Yes.
But they have to be seniors or disabled.
Mayor Coombs and Councilmember Christensen. No, we've expanded the eligibility now so that it's only that you directly pay your water bill. So it could be rental housing or owner occupied, and that you are qualified under the income levels.
Oh, okay. Thank you very much.
Councilmember Santos.
Thank you, Mayor Coombs. I move that option 1, with, of course, bringing back some information as Councilmember Moore suggested, if we could change it possibly. But let's continue this program.
Second.
All right. It's been moved and seconded. Let's vote. And that passes 7-0. Why don't we take a 5-minute break, because I think this next item is going to be potentially an hour plus.
Firehouse Storage Conditional Use Site Plan.
Okay.
I'm starting now. Good evening, Mayor Coombs and council members. Ava Pehajevsky, Senior Planner, Planning and Development Services Department. Again, this is an appeal of a decision that was made by Planning and Zoning Commission last week. What I'm going to do is sort of walk you through the nuts and bolts and the background of it, and then we'll have the other parties speak. So I'm going to start by orienting you to the project location. Again, this is at the southeast corner of Rogers Road and Airport Road. Just use my pointer here. This property is about 43 acres. And if you can see this line here on your screens in front of you, there's a little squiggly line here, and that's Rogers Road right-of-way. So the property is kind of bisected by Rogers Road on the north and the south. And it's historically been used as agricultural property. So in terms of zoning, the whole property, all of it, is zoned business light industrial. A range of uses are allowed, including self-storage, which is a conditionally permitted use, so it had to go to Planning and Zoning Commission for approval. In the Envision Longmont Comprehensive Plan, the property has two designations. The property north of Rogers Road is designated as Parks Greenway and open space, and the portion south of Rogers is mixed-use employment, and that's where this development application is. The property is also in the Airport Influence Zone overlay. In our code, talks about uses that are not allowed in this overlay. One is you can't create electrical interference with navigational signals or radio communication. Secondly, there's a height limit established by the FAA. We'll get into that in the next slides. So there's two applications here. One is a preliminary subdivision plat. Apologize for the messiness. They're looking at taking this and subdividing it into 8 lots. This is Rogers Road here. This is Lot 1. This is about 16 acres, and this is the property where they'd like to do the self-storage project. On the concept plan, when it was annexed, there was a 100-foot, there's an existing 300-foot wide navigation easement, as you can see here in the red. That's north of Rogers. And then south of Rogers in the concept plan, when it was annexed, there's supposed to be a 100-foot wide emergency landing easement here, which will be platted that way when they final plat. And as you can see, there are other lots. This is a lot here, and this would all be a drainage outlot. So within that runway easement, nothing could be developed there. So this is the conditional use site plan. It was for 235,000 square feet of self-storage. It would be built in 2 phases. I would start on the east side over here. I'm sorry, this is oriented differently. This is the north over here. This is Rogers Road. This is the west. This is Airport Road down here, and then that would be the south over here, and then the east side over here. So it'd be done in 2 phases, and so they're doing 70 feet of landscape buffering along Airport, and then there would be 30 feet of landscape buffering, and that's from their property line going in along Rogers, and again on all the property perimeters on all the sides. At issue is, so most of these are mainly 1-story self-storage units. The end caps would be 2-story. They wouldn't be inhabited. They would just kind of be for decorative purposes, if you will. Over here, on the north side, on the kind of the northeast corner of the property, they plan to do a 2-story building where that would be the main office. Over here is the entrance off Rogers Road, and it would be the main office and then a caretaker unit above, which is pretty consistent with self-storage facilities. The heights, this building here would be approximately 34 feet from grade. These are 1-story. I'm going to pull up some elevations next. So probably 15 feet. And then on the end cap cornices, they're going to be about 30, 31 feet. And then over here, they're going to do, if some of you are familiar with Firehouse Self-Storage in Loveland, they do like a fire truck display pad, and so they were planning to put one here. According to the applicant and in their plans, no ladders will be raised. It'll just be a fire truck on the corner there. And so in terms of elevations, again, this is the two-story office caretaker unit at the top, be just shy of 34 feet, and that's up here to the peak, in firehouse architecture, of course. And then on all those property perimeters along Rogers Airport and all the property line boundaries, they'll have that same architectural style. And again, one-story self-storage units, but these little two-story end caps, it'll be 31 feet max. And then these are the interior, again, one-story, non-inhabited, hopefully self-storage units. And so some of the development issues that came up with this project is, of course, its proximity to the Vance Brand Airport, which is just kitty corner to the northwest. So we sent out notices and obviously sent referral letters. We got a letter from Airport Advisory Board, and they had some concerns about safety. Again, there's a 300-foot wide navigation clear zone easement that's on the property. This project is outside of the easement. If you like, I can go back. Again, this is the navigation easement here, and the property is here. And then again, there's a required 100-foot emergency emergency landing easement here, and no development is going here. And this conditional use site plan is not within that 100 feet. I'm just going to bring you forward.
300 feet, yeah.
Sorry. Okay, so airport influence zone. Again, this property is in the airport influence zone. We talked about height at the beginning. There's some FAA regulations. Our airport manager's here tonight to answer questions about that. I'm not an expert on it. But in general, what it says is that you cannot penetrate airspace. There's a certain ratio for takeoffs and landings from the airport that kind of goes this way. David can probably explain it better. And you can't impact or penetrate airspace in these zones. The applicant sought a report or a study from the FAA to confirm whether there would be any impacts from that two-story office caretaker unit building. The FAA did an aeronautical study of this project. It's in your packet. They concluded, or they said that there was no substantial adverse impact to airspace or flying with this project. The day before the Planning Commission hearing, the airport manager filed an appeal to that, and we haven't gotten a decision yet. And we needed to address that at Planning Commission, so we were able to get the applicant to agree to an additional condition that said, if the FAA changes their decision, you'll lower the building by 3 feet, and then there would be no penetration and no issue. The second issue that came up was regarding a species and habitat report. We didn't get one during the development review process. We added a condition of approval that the applicant should bring one up, done by a biologist, and they did. They brought one in last week, and it identified no protected species or habitat. Sorry, I'm going to take a water break. So regarding aviation safety, again, the site plan is mostly one-story buildings. It's the two-story office, I think, is what was at issue. Again, we talked about the FAA restriction on airspace penetration, on takeoffs and landings. The applicant thought that they were penetrating the airspace by 3 feet, so they got the report from the FAA. We got their determination. There was an appeal, and the applicant agreed to the condition to mitigate that if the FAA changed their mind. Planning and Zoning Commission had a hearing on November 16th. 3 members of the public spoke in opposition. Mainly talked about safety concerns from a pilot's perspective. The airport manager kind of expanded on the appeal to the FAA. The Planning Commission ultimately approved the project on a 4-3 vote with 5 conditions, which you saw in your packet. One was the wildlife study, which the applicant has brought to us. They've got one done, and that was completed. The other stuff is plan corrections from staff on their, development plans, and Other constraints like construction, protection of the red-tailed hawk, and again, lowering the building height if FAA changed their decision. We had 3 dissenters. The minutes are in your packet. I think that the gist of their basis, or the basis of their dissension, was on the safety issues that were raised, and also on the lack of the wildlife report, which we got. So we received an appeal by one individual, Mr. Van Zandt, on November 23rd, and he bases his appeal on 4 objections, which are in your packet. The commission acted without full data regarding the airport, that the project adversely impacts the safety of flight and operations at the airport, that the Planning Commission acted without a complete presentation of the facts and data concerning the project's impact to the airport, and that the development violates FAA protected zones and airspace. That's in your packet. And so just kind of going to go over code real quick. In our land development code, there are 3 grounds, permissible grounds to appeal a project. And this is what the limitations are. 1 is the decision is not supported by any competent evidence in the record. The decision is plainly inconsistent with the review criteria as shown by clear and convincing evidence. And again, those review criteria are in the Planning Commission report. And the decision maker exceeded its authority or jurisdiction as contained in the municipal code or the city charter. And the burden of proof tonight is on the appellant to demonstrate one of these appeal grounds. So just a brief rundown of procedure tonight. So you've gotten our staff report with the background. Next, the appellant has 15 minutes to give you a presentation, followed by the applicant, who will give you 15 minutes, up to 15 minutes of a presentation. I believe you may choose to open the public hearing. Is that correct, Mr. Kramer, or not? And so I suppose you can choose to open the public hearing for more comment or not. And then you can ask questions of staff and the appellant and applicant. And then there will be a chance for rebuttal from all parties. And then finally, council discussion and vote. So with that, we'll turn it over to the appellant. If you'll just give us a moment to switch PowerPoints.
You said the burden's on the appellant.
Right.
Correct.
Councilmember Moore?
I'd like to get another clarification here real quick. We have to have a finding on the 4 objections raised by the appellant. Did I read that correctly in the packet? So those 4 points, 1, 2, 3, 4, are the actions we can take in our decision.
Mayor, Councilmember Moore, to be clear, I'm advising staff. Eugene is advising council for the purposes of this appeal. I would say that the council should take the allegations in the appeal into account and make a decision overall whether the appellant is meeting its burden to show that there's no competent evidence in the record to support the commission's decision, or that the review criteria were plainly not met as shown by clear and convincing evidence, or the third one. I'm blanking on what the third one is. So I don't think that the council needs to make specific findings on each count, if that makes sense.
Just any one of those.
Right. If there's a grounds for appeal that the council determines the appellant has met its burden, then the appellant should win the appeal.
Thank you.
Mayor Combs, council, my name is Dale Van Zandt. I am the appellant in this case.
The mic, please.
I have the mic on. Oh, sorry. My address is 2976 Dunes Court in Longmont. I don't want to keep you in suspense about where I'm going with this. The Planning and Zoning Commission did approve the preliminary plot and the conditional use. I assert, and I believe it's to be fact, this development will adversely affect safety of flight, including flights in the air and flights that have problems and have to come down to the ground before they should. It will also adversely affect the economic benefits to Longmont, both from the airport and from the businesses at the airport. I believe the decision should be reversed, move the storage units south, maintain the approach area as open space, parks, ag, whatever we can do with that. It's the right idea in the wrong place. And I have some personal embarrassment with this because the last time I talked to you guys, I was trying to get reappointed to the Airport Advisory Board, and I said my primary concern with the airport is development. This is good development. It's just in the wrong place. And I want to note on the next page, and we don't need to go through that. It was a 4-3 split decision. I am on the Airport Advisory Board. I was reappointed for a 3-year term. These opinions are my own. They don't reflect the board in any way or fashion. A little bit about me. I'm a private pilot. I own a quarter of a small airplane, a Cessna, basically a Cessna 172 with a six-cylinder engine. I do have about 50 flight hours a year, mostly in the local area. I do a lot of training flights at the Longmont Airport, touch and goes and that sort of stuff. Ava went through the 4 reasons that I repealed. We'll skip to the first one. I believe the Commission acted without full data regarding the Vance Brand Airport. I don't believe the staff fully considered the airport in its analysis in the impact this would have on it. And the description of the airport really, while it touched on it, it said to the west is the emissions testing, to the north is ag land, to the east is ag, and to the south is ag land. I don't know if there's any real property owners within 1,000 feet. I do understand there were letters sent to hangar owners. The trouble is I know of 3 or 4 hangar owners, and none of them got the notices. So there's a feeling at the airport that we got involved as soon as we could, but we didn't know about it until the very end. So I'm not sure exactly how that works out. So lack of full data. First thing they did is the commissioners asked for what's the flight activity levels at the airport? How many flights a day? How many flights a year? Staff did not have those numbers. The applicant volunteered the information that she went out on a Tuesday morning about 8 or 9 o'clock and looked around. It was very quiet, not much activity going on, and I would assert there's not a lot of stuff going on a Tuesday morning at 8 o'clock anywhere in town, certainly not at the airport, and certainly not at the storage units. Most of our activity is there in the weekends, Friday, Saturday, and Sunday. It's pretty busy on those days. The 2013 master plan estimated, 2015, and 2015, almost 68,000 operations at the airport per year. An operation is considered to be a takeoff, a landing, or a touch-and-go event. That's got a takeoff and a landing component to it. I'm going to round it up for ease of calculation to about 70,000 operations a year. It's not a lot if you'll do it on a daily basis, but there's a significantly more activity at the airport than most people would ever think about. And it's there and it's real. The airport's got the one northwest southeast runway, 29 and 11. Again, the actual number they estimated, 67,987 operations. It includes 1,224 instrument flight rule operations at the airport. That number is underreported because many pilots on instrument flight rules, if they approach as they get close to the airport and the weather is good, they don't need the instrument approach, they will cancel that approach with center and proceed VFR. These are the ones that landed under instrument flight rules. So who knows what the number is? It could be 1,500, it could be 2,000, but it's probably closer to 1,500. There are 369 aircraft based at the airport, latest estimate. My personal estimate, I've been flying there for about 12 years. I was a meteorologist for 6 years in the Air Force. About 70% of runway 29, 70% of all the landings occur on runway 29, in other words, headed towards the northwest. 30% of the landings head to the southeast. From the northwest, they would then take off over the development area. So there's 49,000 landings a year over the storage area, 21,000 departures over the storage area. Again, most activities on the weekends. This is the traffic pattern from the city's website for Vance Brand Airport. If you're landing to the northwest, you're proceeding in this fashion. Make a left turn, land to the northwest. If you're landing or taking off to the southeast, you take off. If you're staying in the pattern, you make a left turn. There's a number of training flights. At this area, you're going to be right there on a takeoff. You'll be maybe 500-600 feet above the ground. As you turn here, typical light aircraft is going to be 300 or 400 feet above the ground, pretty close to the storage area. And the yellow box is the storage area. So the conclusions about the activity is that there was much more activity than most people would think. The commission did not have that information when they made their decision. They didn't have any idea about how high airplanes would be above the ground at that location and how often. The potential issues from this, noise and safety, both in the air and on the ground. This is just to show 1,500 feet is a number that I really have taken into account in the next few slides. From the end of the runway to where you would intersect it on a takeoff is 1,500 feet to Rogers Road. Not very far. Safety of flight. The proposed development, where it's located, adversely impacts safety of flight and operations in the airport. Safety of flight includes options for off-site landings, a euphemism perhaps, but there's been 5, 6 off-site landings in this area in the last 12, 15 years, on landings only, not takeoffs, as well as in-air operations. We're going to skip through this pretty quickly, but general factoids for the kind of airplane I fly. A landing glide slope of 3 degrees puts me at about 130 feet over the ground at Rogers Road. 130 feet is not an awful far. On a departure, it puts me about 200 feet over the Rogers Road on departure from runway 11. Pretty low. We're going to get a fair amount of noise out of that. We talked about the FAA departure surface. It's a 40 to 1 surface. 1,500 feet from the end of the runway, a plane on that departure path would be 37.5 feet above the ground. You count rivets on the bottom of the guy. The firehouse protrudes above the surface. If the FAA comes back and says, we have this solved for just the protrusion. We don't have it solved for the fact that when you're taking off or landing, there's buildings right underneath you that are hard and not soft wheat or corn or what have you. I have a video. If we have time, we can look at an airplane that's actually on a 40 to 1 departure surface. It is interestingly low. It'll certainly generate noise from people using this, noise complaints using the firehouse storage, and we don't need any more noise complaints, to be really honest. The existing easements, we have a runway protection zone easement that extends to about 1,200 feet from the runway that's supposed to be obstacle clear. Easement 2 was also on the chart, and that goes to about where Rogers Road is. One of the conditions of the approval was that they maintain a 100-foot wide safety approach or takeoff or landing or whatever easement. That needs to be maintained in grass, whatever. If they put a road in there, the way they've designed the road, it's a 24-foot wide clear area on the road. If they expect me to put my 172 down with a 36-foot wingspan, that would be problematical at best. All of the area south of Rogers Road basically is supposed to be in storage. Those are hard buildings. You run into one of those things and it's going to hurt. If you're out there very much and you watch planes in the pattern, you don't know if they're going very fast or not. But my approach speed on landing is 65 knots. That's 75 miles an hour. If I hit something doing 75 miles an hour, I really don't want it to be a building. I want it to be grass or corn or whatever you name it. Some statistics about accident history. Going back for the past 24 years, there have been 27 reported accidents involving the landing or takeoff phase of flight operations. There's some other operations that probably occurred off the runway, off the airport. We're not talking about those. Of those 27, 16 were landing, 11 takeoffs. There were 2 fatalities, no serious injuries. This is really one about every 12 years. The Planning and Zoning Commission talked about what acceptable risk is. This is probably an acceptable risk. But what I'm standing here telling you is that if there are buildings, trees, any other obstructions that are hard and unyielding, I would expect 70% of all the landings and all of the takeoffs are going to involve at least a serious injury in that event if somebody goes into those areas. That's 70% of the total, 30% of the total. Instead of two incidents or 2 injuries like that every 24 years, with the firehouse structure in place as it's designed, you could expect 23 serious injuries. You could expect probably a dozen incidents. To go from 1 every 12 years to 1 every year is really unacceptable. There's no place to go to avoid structures, trees, cars, people, what have you. This was really not part of the FAA analysis. They looked at the 40-to-1 departure surface and said 3 feet up, off to the side, not a big deal. They didn't look at this. They weren't asked to look at this. They should have been. This development almost totally eliminates safe areas for controlled flight into the ground if there's an issue on landing or takeoff. It really restricts increases the risk of death or injury. The 75-foot wide road is probably not part of this. I should have changed it when I got in here. The 3-story building is an additional risk, and all that steel and infrastructure in there is really, it's just not the kind of place you want to go to if you've got an issue. It would be like having an interstate highway with trees planted right on the shoulder. If you've got an issue or a flat tire, what do? You stay in the road and somebody gets you from the backside. Impact on the airport. The Commission acted without a complete presentation of facts and data concerning the development's impact on the airport and its business and its use. Longmont Vance Brand Airport is a significant generator of economic benefit to Longmont, and it's an increasingly important part of the total transportation structure. Direct jobs from the airport, no multiplier effect, no tourism effect. This is just people on the airport working away. 74 direct jobs, 2013, a $3.5 million payroll, an $11.5 million total. They call it output, but what it is purchase of goods and services to support the business at the airport. This proposal is going to negatively impact that in a significant way, primarily because if the FAA has to put a note in their approach plates that says there's an obstruction and there's, large areas of building and construction just off the end of the runway, that will impact how people view and their flight planning. We may not see the traffic that we really want. I'm told by Brian Pickrell, there's Brian. Brian is the manager of FBO, Fly Elite Aviation, that their Jet A fuel sales over the last year has had a dramatic increase, and that's part of their business plan, is bring in transient traffic, give them services, provide services, sell them fuel. This is going to have a big impact on that. It will decrease service revenue, et cetera. The FAA airspace, we've already talked about that. My point about this guy is it's not no hazard. It says there was no hazard to air navigation. The study did not come back. I'm not sure if it really was a study. It doesn't say there's no increase to the risk of an off-site landing. That is the major issue here, the thing that we really need to cover. Thank you.
Thank you. Okay, now the applicant may present data. Yeah.
Thank you.
Go ahead and pull mine out.
don't touch anything. Excuse me, thank you. That's all, right there. There you go, Sandy. Perfect. Okay, are we ready? Give me a nod, or?
All right.
Thank you. Mayor Coombs, members of council, I'm Scott Dunn of Flanders, Ellsberg, Herber, and Dunn at 401 Main Street here in Longmont. We are the counsel to the owner of the property, Elizabeth Schlegel Family LLC, and we're speaking on behalf of the applicant, Longmont ABC Storage, along with Barb Brunk of Resource Conservation Partners. On November 16th, after a hearing and careful review by the Planning and Zoning Commission, the applicant's application for the Firehouse Business Park preliminary plat and conditional use site plan was conditionally approved by the Planning and Zoning Commission. And just to revisit a little bit what was going over with the staff, the question for the council today is whether the appellant has demonstrated the decision of the Planning and Zoning Commission was plainly in error based on one of the more of the following permissible grounds for appeal. One, the decision is not supported by any competent evidence in the record. Two, the decision is plainly inconsistent with the review criteria shown by clear and convincing evidence. Or three, the decision maker exceeded its authority or jurisdiction as contained in the municipal code or charter. Now, in the City Council's communication, there was the Planning and Zoning Commission agenda packets minutes of the November 16th meeting, which did establish the Planning and Zoning Commission was acting within its authority under the Longmont Municipal Code and the Longmont Charter, and based its decision on competent evidence. At a duly noticed public hearing, Planning and Zoning Commission reviewed the information presented by staff, the applicant, and heard public testimony. Also, the agenda, the packets, minutes of the November 16th meeting considered all the review criteria and found that the application is consistent with the review criteria. I would refer you to specifically to the October 27th, 2016 letter to Planning and Zoning Commission from Resource Conservation Partners, LLC, as well as the staff report in the Planning and Zoning Commission communication that goes through each of the review criteria and addresses how this application met all the review criteria for approval. To cite a little bit on the related to the notice of appeal, pursuant to code, the notice of appeal must contain a description of the grounds for appeal, including specific allegations of error, and the grounds for appeal raised the first time at the public hearing and not raised in the notice of appeal would not be considered by the City Council. Now, in this case, the notice filed by the appellant did not cite with any specificity what decision of the P&Z was not supported by any competent evidence or how a decision of the P&Z was plainly inconsistent with any specific review criteria. So we would submit that pursuant to code, the appeal we submit should be dismissed on that basis alone. Now, as was noted in the staff report, basically in summary, that Mr. Van Sant, this was the staff's word, felt the commission decision should be overturned due to safety issues. Now, we would like to highlight, because this is raised, even though we question whether the grounds for appeal as provided in the code was met, given the issues raised, we want to just go through briefly the rules that exist for this property related to airport safety, and there are a lot of them given the location of the property. One, are there numerous navigation easements which will be addressed specifically by Ms. Brunk. There's the airport influence zone rules and also Federal Aviation Regulation Part 77. Now, the planned development, the application that was approved, is in compliance with all rules applicable to this property related to airport safety or airspace. Now, going through Mr. Van Zant's objections, the first objection was the Commission acted without full data regarding the Vance Brand Airport. In simple terms, that is not a ground for appeal under the code. There is no specific allegation of any error by the Planning and Zoning Commission applying any of their review criteria. So that's simply not a valid objection under the code. The second objection was the proposed development adversely impact safety of flight and operations from the airport. Again, there's not meeting the specificity of the code. It's not a ground for appeal, and there was no specific allegation of any error by the Planning and Zoning Commission. And we highlight again, this plan development is in compliance with all rules related to the airport and aircraft safety. Now, towards the end of the argument, as stated in the letter, related to the objection, the appellant is objecting to the Planning and Zoning's decision based on the Commission not applying criteria that are not contained in the code. So basically, when some of these things that are referred to related to safety issues are critiquing the Planning and Zoning for not applying review criteria that simply do not exist. And if they were to be applied in the manner argued by the appellant, we submit would stop any development for this BLI zone property and would result in a taking of the owner's property. The third objection, again, which is very similar to the first in general terms, the Commission acted without a complete presentation of facts and data concerning the proposed development. Again, not a ground for appeal, and there's no specific allegation of any error by the Planning and Zoning in applying the review criteria. Now, the fourth objection related to, while it didn't really tie into a specific ground, we will address it because it is of central importance. Proposed development violates published FAA protected zones and airspace. Now, in the airport influence zone, it's acknowledged, and it's been addressed in the staff report as well, that no structure or object should be erected, allowed to grow, maintained at a height that intrudes into the FAA regulation part 77. Now, in that, and when they conditionally approved the site plan and the preliminary plat, they considered the Planning and Zoning Commission considered the aviation easements and an aeronautical study performed by the Federal Aviation Administration. Now, under that regulation, which is cited in our code and has been raised, the FAA is the agency charged with conducting aeronautical studies of proposed structures to determine the effect on the safe and efficient use of navigable airspace and air navigation facilities. And in this case, the FAA came back with a determination of no hazard. They performed an aeronautical study, and they revealed that the structure would have no substantial adverse effect on the safe and efficient use of navigable airspace by aircraft or the operation of navigation facilities. They do provide the following condition, and we'll just note for the record that the condition is being met as well. So in making the decision, we're looking at the review criteria for the council of whether the Planning and Zoning, did they have competent evidence for the decision? And was their decision, was it plainly inconsistent with the review criteria? In this case, they made their decision based on the recommendation of the Federal Aviation Administration. However, given the airport manager who had a concern and raised a concern about one building and thinking that there could be an issue as to whether that one building penetrated, the commission, in their diligence, added an additional condition that in the event were the FAA to, through that appeal process, reverse their decision, that the applicant would be required to submit a revised building elevation showing the building heights lowered to no more than 31 feet in height. So in simple terms, based on that condition, that the it's a non-issue. If they come back and say the building needs to be lowered, it's going to be lowered. So in no event will they penetrate the requirement under that FAA regulation. So at this point, I'm going to turn it over to Barb Brunk, who will address some of the navigation easements, et cetera.
Mayor, Board, Barb Brunk, P.O. Box 1522, Longmont, Colorado. So this site has a long history of being airport friendly. There's 3 navigation easements associated with the property. The first one was dedicated in 1956, and it's that green area. And basically, that's a clear zone, and that coincides with the runway protection zone in the master plan. The orange one is a 300-foot wide easement that was dedicated. Interestingly, it was executed in 26, but it was recorded in 2012, which the city paid for to the Schlegel family. The third one is that blue area, and at the time this property was annexed and zoned BLI, there must have been a discussion about airport safety because that is an emergency landing easement. So it's a 100-foot wide emergency landing easement. Okay, so a little specificity. So again, in the green area, it's free and unencumbered, and the city has a right to go there and take away things that are in the way. In the orange area, it was about noise and activity and planes flying overhead and the right of the airport to man it, to operate over it. The 100-foot wide area was specific to emergency landing, which we've heard a lot about this evening. And it's a 100-foot wide area that was only allowed to have grass and trees, and roads. No trees, no berms, no anything, 100 feet wide. In addition to that, there's an extra 50-foot building setback on each side of that 100 feet. So in essence, there's a 200-foot wide area that was designated for emergency landing as part of the airport at the time the property was annexed and zoned. The pilot said earlier that 23 feet, this is a collector street, so there's 60 feet of pavement. And then there's that additional grass and sidewalks and no trees. So we put the road there on purpose so that if somebody had to land, they wouldn't be landing on a soft cornfield. They'd have a place to put their wheels down and land. Again, when the FAA did their study, they specifically talked about the northwest corner of the firehouse self-storage. They gave a longitude and a latitude. And when we were at Planning Commission, we thought it was the two-story building where the office was going to be, because that's the tallest thing on the site, which is 34 feet tall. But when you go back to we contacted the FAA. They are not allowed to comment on appeal in process, but they did say, please look carefully at the study. And when you look carefully at the study, it shows that at the northwest corner of the site, they were concerned about a building 34 feet tall, which is the tallest building on the whole property. In reality, the application materials show that the building at that corner is 30 feet 6 inches. So it really is below already the Part 77 surface at that location on the site. That, coupled with the condition of approval, makes sure that we comply with the zoning and don't intrude into the airspace as specified. So back to tell them what you told them in summary. So in summary, we have the abrogation easements that protect the airport. We have the airport influence zoning regulations in our city that protect the airport and regulate this property. And we have the FAA Part 77 surface that applies to this property. And again, we are in compliance with all of those things with the application as submitted.
Yes, and it just conclude that all the aircraft safety rules applicable to this property, this application will be in full compliance with. But then back to the basic purview of what we're dealing with today. We request the City Council approve Resolution R 2016-127A, finding that the appellant has not met his burden demonstrating the decision of the Planning and Zoning Commission was plain and airy. As the public record demonstrates, the Planning and Zoning Commission did not exceed its authority or jurisdiction, which it clearly had. Clearly, the decision was supported by competent evidence, and there's no clear and convincing evidence that the decision was plainly inconsistent with their review criteria. And we request that the City Council uphold the Planning Commission's decision to conditionally approve this application. Thank you.
Thank you. So next we got a public hearing. So you're limited by 2 minutes. I think we have. So okay, you can have 3 because we only have 7 people signed up. So Howard Morgan is the first person.
Mr. Mayor, members of the council, Howard Morgan, address 1932 Amethyst Drive, Longmont. I've been president of the Hangar Owners Association for some time. And what's frustrating about this deal is that we were kept in the dark until just 2 weeks before the last meeting. Only the hangar owners were notified. People that rent a hangar or some other way engaged in the airport had no way of knowing other than bulletins that we put out through the Hangar Owners Association. So that's a little frustrating because there's a lot of aviation expertise on the airport that you could have tapped into on this project. Our concern is preventing any tragedy, and some of the things that have been brought up don't cover what a pilot would look at. I had a discussion this afternoon on the navigation easement. You're planning a road right down the center of the navigation easement, which will have cars on it, traffic, people. So in the event that somebody does need to use that area, they're putting not only themselves at risk, but people in a car, people on a sidewalk. There shouldn't be any people in that area. There shouldn't be any obstructions of any kind to make it a safe area to go. Dave Kopp covered the possibility of turbulence over these buildings, which in my experience on airports all over the world, buildings closest to the approach into the runway can create some pretty nasty turbulence. We have a lot of low experienced pilots and very light airplanes that may not be able to handle it. Plus we have a lot of jet traffic which hasn't been brought up. Dale Van Zandt did a very good study on the project. I would hope that you would turn this down or else get some more information before you make a decision. Thank you very much.
Okay, next up is Robert Bennett.
Mayor, Council, thank you. Robert Bennett, 1233 Columbia Drive here in Longmont. I'm a pilot owner, hangar owner, retired airline pilot. During my 40 years of flying experience, most of issues involving mechanical airplanes occur on or around the airport. We need a safe zone, and I heard a lot of stuff about codes and some lawyers talking, but common sense says we need space around the airport. That's why airports are initially located in remote areas. Sadly, growth grows towards them, and we lose this safety buffer. Safety is a concern, and if this is passed, somebody's going to get hurt. Thank you.
Don Dulce.
Mr. Mayor and Council, Don Dulce, 314 Bristol Place, Longmont, Chairman of the Airport Advisory Board, but I'm speaking as a citizen against the construction of the firehouse storage units in their current location. I hangar an airplane at the Longmont Airport and have been instructing from the airport since 1996. I have over 9,000 hours of total flight time with more than 6,100 hours of dual flight instruction given, and over 16,000 takeoffs and an equal number of landings. I instruct primarily from Vance Brand Airport in aircraft that are rented by students from Elite Aviation or privately owned aircraft on the field, or those that are flown in from other locations. Over the past 2 years, 95% of my flight training has occurred at Longmont. In that time, I've provided 950 hours of dual flight instruction with 6,200 takeoffs and landings operations. That represents about 4.5% of all the operations at Longmont. The risk of a fatality resulting from an attempted landing in an area congested with structures is very high, not only for me, but for my students that are soloing and may have only 15 hours of flight experience. The NTSB accident database, aviation accident database, shows that there have been 534 fatalities in the U.S. since August of 1964. where collision with an obstacle was cited in the accident report. In the descent, approach, landing, go around, takeoff, or climb phase of flight, 363 fatalities, which is 68% of that data, were recorded. These are the phases of flight which occur the closest to the airport and will present an increased risk of fatality if the open space on the east end of the runway is not preserved. I recommend you not approve the construction of the firehouse storage units in their present location. I have provided a copy of the NTSB data along with some fatality data on crashes which have occurred in the vicinity of Longmont and in some phases of the flight I've just mentioned. And if you're interested, I will provide that information to you from the NTSB report, if there's no objection. Thank you.
Thank you. Dan Barry.
Mr. Mayor, City Council, I'm Dan Barry, 930 Champion Circle. I'm a past Airport Advisory Board member, so I'm speaking to you as a regular aviation citizen. I'm going to cut to the chase, just like Dale did, is please deny the approval of the firehouse storage. And it sounds like it's a completely legal, completely compliant bad idea. And what makes it bad to me is that I'm missing any kind of a risk assessment that the operators of the airport will be doing. The jets that use this airport, Mr. Morgan mentioned the jets. We have 20% more fuel flow this year from jet traffic, and that's what we've been trying to attract to this airport through the expo. All the work we've been doing is attract these businesses in. Every one of these operators has a flight operations center. Every one of those flight operations centers measures the risk of their equipment coming into this airport and leaving this airport. That risk profile will go up no matter what. You build buildings on the end of this runway, that's going to be in the books, the risk profile goes up. Those jets may choose, they most likely will choose, to go somewhere else, someplace with a lower risk profile, especially when you couple that with the bad weather and the instrument approaches. The risk profile will go up. And I can speak from personal experience. The fact that the Amgen building is where it is does create turbulence on landing when the winds are strong and they're out of the south. It's not going to help the little planes or the big planes at all. So again, I ask you to deny this. I think it's completely legal, it's completely compliant, and it's going to increase our risk factor and actually not improve the airport as we've been trying so hard to do over the last several years. Thank you for your time.
Thank you. Troy Anderson.
Troy Anderson, 2256 at Gian Way, Longmont. I think that one of the things that we look at here is a lot of lines on a piece of paper, and these regulate theoretically where the airplane's going to go. It's not that way at all. On this airport, I lived at what's the storage facility. I developed that just east of the airport. I've lived there since the 80s. I've seen 14 airplanes go in on the piece of dirt that you're talking about. I don't think you understand enough about that if you got 3 foot, if I'm going to be flying 3 foot above those buildings, they're going to cause a lot of problems. And that's the legal airspace that you're putting you're saying that airplanes are okay at that. It's not that way. Like was just said, the turbulence and stuff coming off these airplanes is going to be really a pretty bad thing. This year, I know, because I was involved in it, there's been 5 different airplanes that have gone off the runway, not right there, but on the other end. There's a Champ, an experimental airplane, and a couple of ultralights that went in out there. Couldn't make it back to the airport in time to get on the runway. And I think that, you just got to really look at the safety issue here of how many people are really going to get hurt or killed out there. The one that comes to mind is a gal that owned a business in town called Flatirons Construction. She was learning how to fly out there. She came over me. I was on my tractor in the backyard. That time we just had 80 horses in that place. And I watched her make a couple of touch and goes. She was a student. She had an instructor with her. And when she came over me the last time, she was about 20 feet off the ground, and I'm well over, extended out. You know where my property is, probably you've seen it on all these drawings. The turbulence came up, there was a gust, they were full flaps, full power, and they waddled around. They got down within 10 feet of the ground, couldn't make it over the ditch, and the tree at the end of the runway used to be there. So they turned south to that red house down there, ended up impacting into those trees, and the owner of Flatirons Materials was killed. I watched that. I saw it. I was one of the first guys to get there after that because I drove my tractor over there. I think that's the thing you got to realize. You can put a 100-foot road out here, but when an airplane gets in trouble over here, he's really low coming into it. And if he makes it into that 100-foot area that you're going to make safe, then he's going to be really, really lucky. For the most part, he's probably going to crash somewhere in a circular area around the end of the runway, not on that little tiny path that you've got him on. Every time a guy changes the power setting on an aircraft, you end up with the chances of having something go wrong. Airplanes get ice in the carburetor. All kinds of things can happen where you lose power.
Right.
And when you lose power, it's all over.
Thank you.
Yeah, okay, thank you.
Ken Bickery?
Thank you. My name is Ken Bickers. I live at 1153 Princeton Drive here in Longmont. Some of you know me as a political scientist at the Doing Democracy Day and other things. I'm also a private pilot. June 23rd, 2015, last summer, I took off to the west in my airplane. 1.5 minutes after I started my takeoff roll, the engine died. I was at 240 feet above the runway. I was pretty far down the runway. I was too high to get back down, and I was too low to maneuver. I was in an open cockpit airplane, and it takes a moment to realize that the engine has stopped. I attempted a restart of the engine. That took 11 seconds. 11 seconds later, I landed in the field west of the airport, just off 75th Street. I heard some corn, about 13 rows of corn, about 6 feet wide. I was completely unhurt. I had a couple of bruises on my shins, got a terrible sunburn standing out in the field all day, meeting first responders and the FAA and people from the airport, and 2 very nice farmers who were very gracious about my unexpected appearance in their field. In that process, the wind was out of the northwest that day, and so I maintained runway heading. I was way too low to maneuver. You're taught the procedure, which is you maintain runway heading, but the wind was pushing me south. I ended up about 50 yards south of the extended center line. That's 150 feet. Notice that, 150 feet. If I had taken off to the west that day, to the east that day on runway 11, and the same kind of wind had happened, I would have been right into this thing, not in the 100-foot, but about 150 feet off that center line. The lawyer says that all of the rules have been applied with for safety. The question is whether you have clear and convincing evidence that something is in serious error. I ask you if you know all of those things about that flight, which ended up very uneventful. The airplane had some minor damage, landing gear, engine cowling, but I was unhurt. I ask you, would you have gotten in that front seat of that airplane? If you're looking for clear and convincing evidence, maybe the lawyer would be happy to climb in the front of that seat to ask the question, have all of the rules for safety been met? I don't think I would have been here to talk to you this evening. I absolutely don't think so. Because if you look at where I ended up and you measure that out to the east, that puts me right into that building. I did everything the FAA teaches us to do. They were very complimentary. They were very kind because I did what I was taught to do, which is to maintain runway heading and put it down in the field in front of me. That's not going to be possible under those conditions to the east. I think this should be denied. I think that the company should find a better place that's a good spot here in Longmont. Thank you.
Thank you. J.D. Glintz? Yeah.
Mayor and council members, I'm J.D. Gleitz at 2113 Rangeview Lane. Ken's talk there is very convincing. I'm not sure mine will be much better, but it goes along the same lines. I'll give you a little bit of my background. I've been a licensed pilot since high school and have worked my entire adult life as an instructor, a charter pilot, and an airline pilot. And I've also, all that time, I've flown and owned small airplanes. Have kept one there at Longmont for 21 years. All the training that I've given and received has included handling engine failures and power loss. I have experienced both of these in both commercial and private flying. The most critical point for an engine failure or a power loss is immediately after takeoff, just as Ken was describing. Because of the low altitude and energy state, correct and immediate action is vital to a safe outcome. With a single-engine airplane, like most of the airplanes at Longmont, the correct action is to maintain airspeed and continue straight ahead for an emergency landing. With buildings in that area, the outcome would jeopardize the lives of passengers and people in the or property in the area. I'm hopeful that Council will join us in mitigating risk and maximizing safety, as all our training does, by not allowing building in the area off the departure end of Vance Brand's runway.
Okay, that's all the people that signed up to speak. Do you have a question? Or?
Mayor, Eugene May, City Attorney, before you go to your next section in the appeal procedure, I did want to raise one issue regarding some evidence provided by Mr. Dolce. The code does provide that city may augment the record by considering additional evidence. I saw no objection from council to Mr. Dolce providing you with a document. However, the code also provides that the parties would have an opportunity to rebut that evidence. I think it would be fair, and I would recommend that the parties be given an opportunity to review that documentary evidence prior to the rebuttal period so that they can review it and determine whether they need to rebut.
Yeah.
Show your copy.
Yeah, whatever. Here. So any discussion or comments from council at this point? Councilmember Peck.
Thank you, Mayor Coombs. I have a couple of concerns. First of all, I am concerned about that road that is going through the 100-foot, what did you call it, easement? Yeah. But the other thing, when I'm thinking about the city and what the city has always talked about, what they want to do with that airport versus what the developer wants to do, they don't seem to be coincide at all. For example, I have heard in the past 3 or 4 years that we want to expand that runway, extend it, and make a larger airport, an airport that jets can fly onto and to have more commercial business on the airport site. How does having the storage unit there affect that? It looks to me like it would affect it greatly. Is there any comment? Is David Slater here? Do we still have those plans? Are those still future plans for our airport?
Mayor Coombs, members of the council, David Slater, airport manager.
Mayor Coombs, Councilmember Peck, yes, ma'am, that is in the master plan for an eventual runway extension. The different ways that can impact it, even though the runway extension is going to the west, there is still the development part of that. So when you start looking at getting the more corporate type development into the airport and things like that, if you want to start looking at bringing in a more precision instrument approach to get lower minimums and things like that, you would need property to the east for your approach lighting systems that go along with the ILS that will give you a clearer and a sooner visualization of the airport environment, which is pretty much what the pilots depend upon when they're on an instrument approach on an ILS. Their cue in order to make a decision to land or to do a missed approach is whether or not they have the runway environment in sight, and part of that is that lighting system. So that would impede on the eastern end of that approach lighting system. Once we would want to expand to an instrument landing system, that would be one impact.
So in your opinion, does this development there, would that impede that master plan? And did planning and zoning take the master plan into effect when they okayed this development?
Mayor Coombs, Council Member Peck, I don't know all of the things that planning took into account throughout this. Now, not every single project that is associated with the runway extension is specifically listed in the master plan. So I can't speak to is why the decision was made that was made.
I think that's a huge concern when we're looking at the development of the city and the growth and the expansion of the airport. Do we really want development there where that runway is going to be going? I think that would be a question perhaps for planning and zoning.
Well, we're here basically to say, did the planning and zoning plainly make an error? You know, was the decision not supported by competent evidence? Is the evidence plainly inconsistent? I mean, I agree with everything the pilots and everything says, but our job right now is not that, whether we agree or disagree. It's these 4 items. And, you know, in my mind, as much as I would like to not have this here, and I'd love to have nothing but green grass and great fields for safety, I totally agree with that. But that's not what we're tasked to do here tonight.
No, it isn't, but I still want to understand if planning and zoning looked at these issues, since it wasn't brought before us ever.
Councilmember Peck?
Thank you.
Oh, excuse me. Oh, Councilmember Christensen, are you?
Well, I think she's here to answer the question.
Okay, your question. Okay, excuse me.
Mayor and Councilmember Peck. So regarding the Planning and Zoning Commission's decision, your question regarding the airport master plan, they're not tasked to review the airport master plan as part of this. What they are tasked to do is look at what the zoning of the property is and what the land use designation is. That is a council policy decision. And so that's all they're tasked to look at. This property was annexed in 1999, and council approved it with a zoning of business light industrial and with an underlying land use designation of industrial economic development. That was council's decision. More recently, as we went through the Envision Longmont process, council again looked at this surrounding land area. They did redesignate that land north of Rogers Road as Parks, Greenway, and open space. I wasn't part of those decisions or discussions, I guess, so I'm not sure if that was related to airport safety or for other reasons. However, the property north of Rogers Road cannot be developed, is encumbered, cannot be developed, can only be open space. So they were weighing those policy decisions, the zoning, what is allowed there that council decided on, what is the land use designation.
Okay, thank you.
Councilmember Christensen.
This is several, I think about 2 years ago, this council made a decision to hamstring ourselves and turn ourselves into basically a rubber stamp of planning and zoning, and or the Planning and Zoning Board, rather. We are only allowed now to make a decision based on these 3 criteria. And these criteria force us to claim that, well, in order to appeal, okay any appeal, Planning and Zoning Commission has to have been in clear error. You know, here what we have here is a property owner who legitimately would like to develop their property, and a lawyer who is going by the law, and they're both very nice people, but what we have are pilots who every time they get in the plane risk their life, and they're telling us that we're creating a dangerous situation. There has to be something that we can appeal on other than planning and zoning having made an egregious error. There's nothing more important to City Council than to protect the lives of the citizens of this town. And if we simply okay, I mean, to me, I would like to see a compromise made so that they could develop the land in a way that is good for them, but also, I mean, does it have to have an entrance on Rogers Road, which is a very tiny road? Does it have to have a 34-foot building that's kind of adjacent to the emergency landing and landing zone? Can't it be moved down to the southeast corner? Can't we kind of have a meeting where everybody makes some kind of compromises for the safety and the betterment of all, instead of turning it into just a legal issue with people who are, every time they get in the air, you know, my dad has landed in many different fields in 1927 when he was learning to fly. Nothing has really changed, because when you need to land, you need to land, and it's seconds make the difference between living and dying, and that's always going to be true for a pilot. So when the pilots are telling us that this is a dangerous situation, and I would like to see I'd like to recommend that we find a way to have a meeting between the people who own the land and the airport pilots and see if they could work out a compromise.
Councilmember Bagley.
Thank you, Mayor Coombs. I always cringe a little bit when people rip on lawyers. I am a lawyer. Scott Dunn, who's here tonight, is a fantastic lawyer. I also know many of the fine citizens and airport constituents that spoke tonight, and I respect all of them and their expertise. They know what they're talking about. But I kind of view this as, so I agree with the mayor, and I don't think we've hamstrung ourselves 2 years ago. City Council changes all the time. But back in the 1990s, this business, or this landowner annexed into the city, and that land was zoned business light industrial. I view this very similar to the argument that we hear from my neighbors up in the Sundance neighborhood. Don't let in Providence. I want a park. If the airport owners want to get together and buy that land and create a park and keep it as open space, I say go for it. I'd like to see it open space. I would love to see a huge empty area all around the airport. And I certainly understand why airport users would want that as well. However, you've also got to balance that with the rights of property ownership. And they have the right to build their business light industrial, because that's what City Council approved back in the 1990s. And if they don't build that, something's going to go there. And I think that, I mean, and I respect lawyers and judges, because when I go into court, they've got the Colorado Revised Statutes, they have municipal law, Lawyers, Eugene May helps us write the law. Lawyers interpret the law. Lawyers, that's what we do. We work in law. And if our society was, we just got to do whatever city council or a couple politicians wanted to do in the moment, we'd be screwed. You can quote me on that times call. We'd be screwed. And here, the questions before council, okay, we can't just do what we want. Legally, first of all, the burden is on the appellant, meaning Mr. Van Zandt has to show that P&Z was wrong. He comes in behind the ball. Everybody in this kind of situation, court, and we are acting as judges, not juries, not city council people. We are technically acting as judges, quasi-judicial capacity, where we need to have see the responsibility to understand the law and apply it. But we have to show that the P&Z was plainly in error, not egregious error, just were they plainly in error based on one or more of the permissible grounds. Number one, the decision is not supported not by competent evidence, but by any competent evidence. And the P&Z decision, when I look at the map, there's a navigation easement for emergency landing. Then it goes into the, there it goes, boom, 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 and has the emergency landing. I understand the wind. I understand all that. The FAA didn't have a problem with it. I certainly understand that it becomes less safe, but things become less safe all the time. We increase the speed limit from 10 miles an hour to 25 miles an hour. Things become less safe, but we want to get places a little quicker. We allow cars on the road instead of horses and buggies. Oh my gosh, things become less safe. Everything, we can always make the argument that things could become less safe, always. But less safe is not the criteria. It's, number one, was there any competent evidence based on the FAA and based on the map, based on council's decision earlier to zone it as business light industrial? I see everything. I might not agree with it, but I think it's competent evidence. I also think that is it plainly inconsistent with the review criteria as shown by clear and convincing evidence? I don't think it is inconsistent with the review criteria. And I also don't think that the P&Z exceeded its authority or jurisdiction as contained in the municipal code or charter. So as much as I'd love to have it as open space as an airport user, I own a hangar out there. I own a plane, which I'm selling, by the way. Give me a call. But as much as I'd love to vote to say no, go build elsewhere, I think the law is clearly on the side of the petitioner. And unless I hear additional evidence in the rebuttal period, I'd be upset as an attorney if the judge just ignored the law and did whatever they wanted because that's what they felt like that day. And I hate it when judges do that, and I'm not going to do it tonight.
Councilmember Moore.
Thank you, Mayor Combs. Well, the only place that I could see there's any kind of an argument at all, and there again, it may not be plainly evident, and there's not any convincing evidence around it, would be that the application will not significantly adversely affect surrounding properties, the natural environment, existing or planned city transportation or utility services, or facilities, or the impacts will be mitigated to the extent feasible considering existing plans and zones. Well, it comes back to the clear and convincing evidence. There have been assertions made that it's going to impact our airport economically, but there's no convincing evidence around that. From my perspective, I'd like to think that there would be, so I could say that I would not support this, but I think that at the end of the day, after Councilman Bagley's descriptions, I think that the applicant has followed through and they've had their fair review, and the Planning and Zoning acted within its authority. So we're, as much as I hear the airport users, they're concerned about the safety, I look through our code, there's not one word that says anything about safety except not significantly adversely affect surrounding properties. And to me, that hasn't been shown. If there's anything in the rebuttal, then I'd like to hear it.
Councilmember Peck?
Thank you, Mayor Coombs. First of all, I did not hear anybody beating up on lawyers. We actually said that we understood the legal part versus the pilot's concerns. And my question about the vision in the master plan actually had to do with the portion that Councilman Moore talked about, the affecting any city decisions in the future and the environment, et cetera. And that's why I asked about the master plan. Was this consistent with that? The other thing is that for the pilots out there, we didn't see this. It did not come to council, so there was no discussion about whether or not this was a good plan or a bad plan, and did we have any input into the development of it. So Councilman Bagley is correct that we are only voting on whether this should, on these three issues about the appeal. So for Eugene, may I have a question for you? Should we vote on this before we know what the results of the appeal are to the FAA?
Mayor and Council, Eugene May, City Attorney, that's really a policy decision for the council. I don't think it's necessarily a legal issue. I think council is very aware of the permissible grounds for appeal and the standards to be applied.
Mm-hmm.
If you factor in the procedural status of the appeal of the FAA and put it within the context of the three grounds for appeal, that's how I would advise council to take that piece of information into consideration for your decision.
But on that same thing, one of the things that, you know, the appeal, the punch through of the 34 feet, which is now 30.5 feet, which doesn't punch through according to the elevation drawing. So there's really, you know, virtually very little risk that the FAA is going to, you know, reverse their decision. So
I would point out that the planning and zoning resolution that conditionally approved has
that coverage anyway.
Considered the FAA appeal, and if it were to overturn its previous decision, then it would have to go to 31 feet.
Councilmember Santos.
Thank you, Mayor Coombs. I was just going to bring that up myself, that the condition was already, that condition was already in the PZR that came through. Looking at this, and I have the advantage of having a mother-in-law that lives on Oakwood Drive, right off the airport in Nelson. If you fly the pattern and you're landing on 29, going into the west towards the mountains, I know because they fly over her house. Everyone flies over her house. You got to make a sharp turn to the north to go over where this facility is going to be. Now, normally, and I know depending on weather, and having grown up around aircraft my entire life, depending on how the wind is blowing, how turbulence and everything else, it depends on where they go in. But if I've seen aircraft go past towards Schlegel, past 82nd, and continue on past 82nd, which is also Anderson Street, and make the big turn coming in over the South Flat Ditch and go into 29. Now, if you're leaving, you know, I get part of that how that can potentially be dangerous. However, I also fly into an airport when I visit my family in Texas that's surrounded by houses and industrial buildings, and I fly into Houston Hobby. And those are much bigger planes. I did not find anything the appellant brought forth as any reason to overturn planning and zoning. I'm not sure how this appeal got to us. And I had the same question as several other members. How is this going to affect the economic benefits of Vance Brand Airport? I don't see it. And I've just been told it's 11 o'clock. Mayor Coombs, I move that we extend the meeting past our last agenda item until necessary.
Okay, I'll second that. Let's.
Hold on.
Yes.
I just need to get. Thank you, Mayor Coombs. To clarify, the motion is, say it verbatim, it was to extend the meeting. That's different than the motion. But the motion is to finish all the agenda items, or just finish this agenda item?
Finish all of our agenda items.
All right, thank you for the clarification.
We get elected to finish our agenda items, so regardless of how long the meeting goes, we should have finished our agenda items.
Okay,
That's
we got
the
a motion, it's been seconded. Let's vote. And that will pass 7-0.
So, anyway, getting back to what I was going to say, what I was talking about. That I don't get that, and whatever was said in first call, public invited to be heard, wasn't in testimony. I do have concerns about getting stuff in the middle of, and I know that's happened, but I look forward to hearing the rebuttal from the applicant and the appellant, whether it's this or whatever anything else has been said here tonight.
Okay, so now can we just move on to the rebuttal? So is there any rebuttal from staff at this point that we haven't covered?
Yes, Mayor Coombs and council members, just a couple of things that were noted during the hearing. One was we heard a comment that some airport, the hangar owners were not given notice. Our zoning code requires us to give a 1,000-foot notice to all property owners from the project site. We did send notice to all the airport hangar owners. We're not required to send it to the renters, but we did send it to all the owners. There was a list. I have the certifications here. We sent out 170 notices 4 times. Once for a neighborhood meeting before they even filed the application on October 21, 2015. Again, when the applicant filed their formal application in December, we sent a second notice to all 170 property owners on December 21st. Oh, that's like tomorrow, right? Okay, so a year ago, 2015. And then again, 2 weeks before the Planning Commission hearing, we sent a third notice on October 31st of this year. And then again, we sent a fourth notice when we had the appeal hearing set. We sent that, the applicant sent it out on December 6th. So just wanted to clarify that as far as we understand, all of the notification requirements in our zoning code were met. Second, I heard a comment from one of the council members, or maybe it was also from the public, concerns regarding that 100-foot runway emergency landing easement that's supposed to go on the south. And there were concerns about a road being there. And so just so you know, when the Schlegel-Williams annexation came in, they had to submit a concept plan that's required with all annexations. And that 100-foot easement was shown on the concept plan, and specific language on there said can have landscaping and roads only. So it specifically said roads. So for us to prohibit roads there would require an act of city council through an annexation concept plan amendment. So that's not, our hands are sort of tied here at the city as far as what we can and can't do there, but a road is permissible there. And I think that was there was a, let's see, one other comment that was raised. I think Councilmember Christensen wanted to know why does the property have to be accessed from Rogers? Why can't they do it from Airport? Actually, Airport Road is a designated principal arterial in our comprehensive plan, and our development code or municipal code prohibits access onto arterial streets. So they would have to go back to Planning Commission and ask for a variance to be allowed, and our traffic engineers and public works staff, I don't know that they'd be terribly keen. We'd have to analyze it, but that wouldn't be allowed. You'd have to go through a variance. And lastly, we already talked about it, the zoning of the property and being a council policy decision, and that Envision Longmont changed some land use designations, which kind of touched on earlier in questions. Thank you.
Okay, now it's time for the appellant rebuttal. This is limited to 5 minutes.
Mayor Combs, Council. You have the laws and the rules and the codes and et cetera, but I would like to remind you that you guys make the law here. You make the code. If you're tying your hands, it's because you want your hands tied. What you really need to do is look inside and put a little common sense into this situation and ask yourself if you'd like to be driving down an interstate highway doing maybe 75, 80 miles an hour with trees parked on the, planted on the shoulder. Especially when you have a flat tire and you have to get off the road and all of a sudden there's no place to go, and it's a little scary because you know if you get off the road you're going to be hurt, possibly hurt bad. I would agree that the review criteria 6.1D says there should be no impact on surrounding transportation facilities in the area. If Vance Brand is not a transportation facility, then I don't know if I could possibly recognize one. I was out there yesterday and watched a charter flight come in, drop off passengers, pick up a passenger or two, take off in the middle of the day. They left the area with 600 gallons of new Jet A fuel on board. It was a very lucrative day for Fly Elite at that point in time. Other review criteria for this, appeal criteria, is that the Planning and Zoning Commission acted without credible evidence. I would submit that the reason it was a 4-3 vote was because 3 people on the commission wanted to defer the decision until they got more and better information about the impact of this particular development on the airport and on safety of flight and safety of aircraft and safety of people on the ground. A 1-vote majority canceled that desire. There was a strong feeling on the Planning and Zoning Commission that they didn't have enough information to make a good, credible decision. I submit that that's really true. The runway extension, did the Planning and Zoning Commission take into account the master plan? They're not required to. It exists. It's a nice thick book about this thick. There wasn't one in the building. I don't know why there wasn't one in the building. Again, they did not have the information they needed to make a good decision. Common sense has to come into play somewhere. I understand the laws. I am probably the last person in this room that would deny somebody the opportunity to develop an area of their own, what they own. This is a good idea. It's in the wrong place. Move it south a half a block, and I think a lot of this objection will go away. And by the way, not being able to take an exit off of Airport Road is one of your own rules. Where are we here? Have you made the rule and you can't change your mind about the rule? I'm not sure that that's a good idea. Look at the entire picture and then ask yourself, do you want to talk to the person whose husband or wife or daughter or son just landed in the middle of a whole big group of airport buildings right off the end of the runway and died as a result of it when he didn't have to? Thank you.
Okay, the applicant now has 5 minutes. Rebuttal.
I just want to address one short thing. It was we talked about the review criteria, and specifically the one that said we wouldn't significantly adversely impact adjacent surrounding properties, the natural environment, existing or planned city transportation or utility service or facilities, or the impacts will be mitigated to the extent feasible considering existing plans and existing zoning for the area. So the existing comp plan shows it as employment. The existing zoning is business light industrial, and the abrogation easements as planned and the location of the facilities as planned mitigate those impacts. And we submit that the applicant has not met the burden as they're required to do under the code and request that you uphold the Planning Commission's decision. Thank you.
Okay. So now, council, if there's any further discussion from council, or Councilmember Santos.
Thank you, Mayor Coombs. I move to uphold the decision of Planning and Zoning Commission finding that the preliminary plat and conditional use site met the review criteria.
All right, that's been moved and seconded. Councilmember Bagley.
Thank you, Mayor Coombs. I just wanted to address one. Your arguments ring true, Mr. Van Zandt. They do, to me. However, under our Constitution, it's ex post facto. You can't change the rules of the game once the rules have been established. So that's we can go back, and if we want to change the appellate process, we can consider that. If we want to change the criteria, we can consider that. If we want to change the master plan, we can consider that. We just can't consider it tonight. So I just wanted that was the only thought that I had.
Okay, we have a motion. It's been seconded.
Mayor, before you vote, so staff has prepared a resolution in the council packet that would uphold the Planning and Zoning Commission's
It's basically to
decision.
approve the resolution R 2016-127. That would be the correct
If the maker
motion.
of the motion, if council would so like
Yeah.
to, that would probably be better.
So would you amend your motion to that? Yes. Right. Okay. And who's, yeah, the second, okay. All right, so that's what we're going to vote on is to approve resolution R-2016-127A. All right, it's time to vote. And that passes 6-1 with Councilmember Christensen dissenting. Now it's time for final call. Public invited to be heard. So, if there's anybody that'd like to come down and speak, all right, I'm going to close final call. Public invited to be heard. Now it's time for mayor and council comments. Councilmember Santos.
Thank you, Mayor Coombs. Sorry about my voice. I'm still
Yeah.
trying to get over this bronchitis. Merry Christmas and Happy New Year and Happy Hanukkah to those that celebrate Hanukkah and Festivus for the rest of us and everything else. Happy holidays, but, I'm more of the Merry Christmas type of person. Be safe if you're traveling. I know we're meeting tomorrow at 4 o'clock. But this is really the last time we are kind of all together.
Yeah,
I wish you all great tidings with your family and your friends, and remember those that are no longer with us. But be careful, be safe, and we'll see you next year.
Thank you. Councilmember Christensen.
Yes, without getting too churchy here, this is the time of year that we celebrate, regardless of a lot of other circumstances, a carpenter from very humble circumstances who taught hope, mercy, forgiveness, courage, and brotherhood. It seems to me we can all agree on those. So, Merry Christmas, Happy Hanukkah, Happy Kwanzaa, Happy whatever you celebrate, and I hope we all cherish our time with our friends and our family and have a lovely holiday.
Thank you. And we may even get some Christmas snow on Christmas Day. Councilmember Peck.
Thank you, Mayor Coombs. I just want to weigh in and wish everyone a happy holiday, Merry Christmas, Happy Hanukkah, Happy Kwanzaa, and Tet, and be safe.
All right. City Manager, any comments?
No comments, Mayor, Council.
City Attorney, any comments?
No comments, Mayor.
All right, this meeting is adjourned.
Eugene, you only get Game of Thrones as long as you say no comments. I'll bring it in.